of today, I just want to have a brief certain points I want to bring to your notice, or I can say I am reiterating the same thing what is being told to you all these 3 to 4 days. Because tomorrow is institutional orientation. I was supposed to interact with you, but for some reason I can't be not available for my some official duty. So hence I just want to interact and inform you that you have gone through this 3 days of session. Today is the 4th day, right? And there were so many different aspects has been addressed. Different speakers from the university, some are from outside the university, came and addressed to you. And this is not for this week, right? This is many of the things, it is lifelong learning, and some of the things you have to follow meticulously when you are in this institution. So tomorrow you will be getting a handbook which will explain about, can I just view the handbook? Which will explain about your whole course structure, right? How is the semester, what are the subjects you are going to learn, and also it will have code of conduct, rules and regulation to be followed in the institution, rules and regulations to be followed in the hostel. So this book, I am just displaying it to you here. This is going to be a handbook and we are going to issue it to you tomorrow. So if you go, can you just scroll it? Yeah, you come to the semester wise. We don't need this, they will be reading this. Come down, come down. See, if you see this, you will be getting each course, how the contents are. So each semester, what it is going to be, what is the scope of each course, each program, what you have taken. See here, again, I want you to understand it is called as program. If you say BSc Anesthesia and OT Technology, it is the program. And each semester you are going through the courses, and that is displayed here. Including the UG and PG courses. So this way you will understand what is that you are going to learn for all the 3 years. After all this, there is a code of conduct, and I am here to speak about that. So even important contact numbers we have put, so whom you can contact for need, faculty list is there. The policy on substance abuse is included here. Rules and regulations of the hostel and code of conduct is also displayed. So dear students, You will be finding this on your walls, the notice board. No mobile phones allowed in the classrooms, and if it is found, it will be confiscated and you will be fined. If I find anyone without the uniform, proper uniform, dress code, with your ID, proper shoes. When I say shoes, it should be black. Otherwise, there will be all colors of shoes with butterflies flying on that, glitters coming out, you know. That you can wear only with the torn jeans, not with the uniform, right? Hair neatly combed. Sometimes I am worried where the birds will come and sit and hatch some eggs on that, you know, that kind of hairstyle. Right? That's not allowed. Okay? Please understand, you are in healthcare profession. You are dealing with patients. Right? Anyone is here who is not dealing with patients? Everyone is associated with the healthcare industry, hospital care, patient care. And I don't want to see anyone haphazardly dressed, shabby clothes, dirty uniform. Sometimes that uniform will be not seen water for 2 to 3 days, you know. So I don't want to see that. So that is what especially I want to address. Please do not tell me that college they are doing, this college. No, I am talking about Faculty of Allied and Healthcare Professions, Institute of Allied Health Sciences, Department of Hospital Administration, and Yenepoya Physiotherapy College. Right? So please understand what it is told today. You have to carry it for all the 4 years. Proper what to wear, what not to wear is being told, so you have to follow that. Another important thing what I want to tell is attendance. Already that is mentioned. 80% of the attendance is must. That does not mean 20% you can sit at home. The 20% we understand that there are concerns. We are human beings, we may fall sick. There are certain urgent, some things we have to give attention. For that 20%. So 80% of attendance is must, and no one is going to come and tell me, I got 79.5, only 5%, please 0.5% can I get. I don't have any attendance in my kitty, so I cannot give. You get, are you clear? Are you clear? Yes, that's nice. Right? So these have to be taken very, very seriously. Your course is based on credit system. That is, if you attend the class, you get credits. Right? So the credits, all it is displayed. There will be more sessions explaining how the credit calculations, all that will be done to you. But today I just wanted to brief these 2 important points, that is discipline, dress code, anything with substance and ragging. First I suspend them, then I conduct the inquiry. You will receive anyone found fault, immediately they will receive. As soon as the inquiry happens later on, because we have to see all the important things. First, you will get an order, suspension pending inquiry. Okay? Another area is malpractice. During the examination, again and again, we will be guiding you. Please treat these things very, very important, because if you are found, you will lose whole semester. If you lose one semester, you will lose 1 year, because in a year there are 2 semesters. Semesters happen in the odd and even phase. So first semester, third semester, fifth semester is called odd semester. Second, fourth and sixth is called even. So when there is odd semester, you can join to the odd semester. Say you are suspended for 1 semester for 1 month. You will not get attendance 80%, right? So you have to repeat. When you will repeat? Next year, when that odd semester is going on. Do you understand? Am I clear? So at the end, you will lose 1 year. And I don't want that to happen to you. That is why I am informing you today, before you start. Clear? Are you clear? Good. So from 18th, we are starting your regular classes. We have every third Saturday holiday. If any student wish to go home, hostel students, after the sessions you can go, but you have to report back on time, and Monday onwards we will be meeting you. Your teachers will be meeting you in 4 different campuses, as I said. Some of the classes are going on in Kulur campus. Some of the students will be reporting to Mudipu campus. Some will be reporting to Naringana campus, and some in Derlakatte campus. That will be informed to you by your teacher when tomorrow you are having these sessions. Right? Yes. So 18th, as per your timetable, we will all be meeting. So all the very best. I thank the organizers to giving me this brief time to interact with you. And now the 4th day sessions will be starting. All the very best. Thank you for listening. I want to clap to you all for listening for 4-5 days. Great work. Thank you. Welcome again.
Good morning, students. How are you all? Okay, come on. This is our 4th day of Deeksharambh. So a hearty welcome to the day 4 of the Deeksharambh. By now, hope you all have got a clear picture of the university and how it functions, right? Yes. So today, we will be dealing with some students-oriented topic. So let us start today's session. Now, in today's fast-paced world, students are often confronted with demanding academic schedules, social pressures, and the temptation of convenience, food, and sedentary lifestyle. However, maintaining a healthy lifestyle is a paramount for students' physical, mental, and academic well-being. I hereby extend a warm welcome to Ms. Harshita, dietitian from YMCH, to elaborate on the significance of a healthy lifestyle for our students. I request Ms. Rashmita from AOTT to give a brief introduction of Ms. Harshita.
Thank you, ma'am. It is my privilege to introduce Ms. Harshita Avinash Gatti. She holds a bachelor degree from St. Aloysius College and a master's degree in dietetics and applied nutrition from Manipal University of Higher Education. She has a teaching experience at Yenepoya Nursing College and has been a spokesperson on a panel discussion on role of nutrition in management of COPD. She is currently working as nutritionist at Yenepoya Center of Nutrition Studies and at Yenepoya Medical College. I hereby give a warm welcome to the ma'am.
Good morning, students. Am I audible? Yes. So how many people did not have breakfast in the morning? Can you raise your hands? Okay, this is going to be a situation for the next few years. So make sure that you're having a good breakfast. Otherwise, it's going to be a vicious cycle where you're not going to be concentrating in classes, or you'll be eating junk. Because college life is somewhere where you can't concentrate on food. So if you have taken up mess food, there are some things that you can do. So we'll talk about it in next, coming. Yes. So today we'll be talking about healthy diet, lifestyle diseases, risk factor, and physical exercise that we have to look into. So we are a fast moving pace, and everybody is talking about different kinds of diet and how we can look thin for the next 3 months if there's a function coming up, or we need to fit into a certain kind of dress, right? And some of the diets that you've come across is keto on the fashion right now. The other diets are paleo diet. There is something called cabbage diet, banana diet, or only eating fruits in the night. So there are different diets that you might have come across. So yeah, so we'll see why Indian diets and how diet is going to make a difference in your studying and how you're going to cope up. Next. Yeah, so what does your food, basically your balanced diet and an Indian diet in particular is a complete diet. You don't have to have fancy foods or a broccoli or something that is from outside or a pseudo food to feel that you're losing weight or gaining weight or keeping yourself healthy. So food that balances your health and your taste and makes us feel fit, prevents undernutrition or overnutrition, and prevents lifestyle diseases. Now there are some foods, if you consume, you feel more lazy. And there are some foods that if you consume, you feel more active. Correct? You kind of feel sleepy after eating some foods, right? Yes. So there are some foods also that makes you feel active in the morning. So the kind of food you eat through the day or you start your day with is very, very crucial. So make sure that you're having your breakfast. Let's say you skipped your breakfast. So what do you do next? The next break around 11 o'clock, you all go to the canteen and eat something unhealthy. The options that we have here are unhealthy. For example, a puff or a juice, a canned juice. So there is no room for you to feel good about the day. Again, around 1 o'clock there is lunch, which you don't feel like eating because you've already filled your stomach with the egg puffs or any kind of pastry or junk that's available. So make some time for breakfast. It is very, very important for the day. I keep stressing on it because that's the main problem we've faced as students, and at least it can be a good thing if you all don't. Next. So yeah, food basically gives some things, right? So foods give energy. there are certain foods that only give energy. There are certain foods that help in muscle gaining. There are certain foods that only help in giving you minerals and vitamins. So the energy giving foods would be cereals like your rice, ragi, wheat, whatever you're eating. There are protein giving foods such as pulses or non-veg protein like the egg, fish, mutton, beef. So these are all protein and fat giving. There are vegetables and fruits that give you good amount of fiber and minerals and vitamins. So you need to make sure when you are looking at your plate, there should be all these. Okay, but what does usually, how do our plates look like? There's a lot of rice, less of vegetables, and a fried item. So we need to change that. Next, this is our Indian thali, correct? So there are some good things in it and some things are bad. Can you at least detail the papad which is there is not good? There's a papad there which is not good. Other than that, there are, it's a multicolored thali. There are vegetables in it. There are different kinds of curries. So you make sure that your rice consumption, with that there should be good amount of vegetable. In a day, you are supposed to consume vegetables compulsory in the raw form and in the cooked form. Now most of you might have taken the mess service here. And your mess food might look boring after some time, but make sure you're reducing the consumption of rice and increasing the consumption of the sabzi that is there in it or the dal that is added to it. Because most of our classes we are sitting the whole day. There is less activity. If you are someone who is concerned and you join a gym or you start an exercise, then there is an exception. Otherwise, we all have a sedentary lifestyle where we are sitting in most of the class. So make sure that you are reducing your rice consumption or carbohydrate consumption. So next we'll talk about the different kinds, what your food should consist of. The food, carbohydrate, like I mentioned, are energy giving foods. So the rice, dosa, the puttu, all these come under energy giving sources. So they make out of 100%, 60 to 70% of your food is carbohydrate based, correct? Next, moving on, we have proteins. That's the next 15 to 20% in your 100% of your food in a day should be protein that you're getting from dal, pulses, lentils or chicken, fish, the other meat products, but not in the fried form. Because when it comes to protein, we are consuming it in the fried form. Even if we are eating fish, we are consuming it in fried form, kebab. So these are the proteins. So instead of consuming it in the fried form, can we try consuming it in what is there in the gravy? The less oil is consumed, then it is better for you. Otherwise, if you're frying the protein, the best part about the good nutrients from the protein is lost. So once in a week you can have anything from outside or have fried food, but make sure in a week, the 6 days you're consuming good food or the food that is prepared in the hostel or mess. Because eating out is convenient now. In your touch of your fingers, there is a lot of, food ordering apps. So make sure you either lock it or don't try to order food for the next 6 days. And one day, probably on a Sunday, if you feel like one meal in the day, might be an afternoon or dinner, you can consume from outside, but try to stick to the food that's provided in the hostel mess. If you're someone who is traveling from in and around Mangalore, try to stick to home food. Nothing is as good as home food, because it will be too late when you finish your 4 years and you realize by then, because there are a lot of diseases that have come up, and we are not like our parents where we used to eat home food. Our food starts from outside and we are getting diabetes, hypertension and other diseases way sooner in our 30s and 20s compared to the older generation who get it now in 40s and 50s. So if we want to avoid all that, so we need to consume, and our Indian diet is the best diet, trust me, because the amount of rice, the dal and all the curries that are involved in the Indian diet is the best. You don't have to follow some fancy diet where you only have to eat like a bowl of vegetables or a bowl of fruits. That's not done. It's not going to, it might give you immediate results, but in a long run that is not going to sustain. So yeah, moving on, the next slide is good eating habits. So we need to maintain a proper regime when it comes to washing our hands, oral sanitation, or even, you know, not watching TV. Now it's not TV, it's more like eat, sleep, Netflix and repeat kind of situation happening. Everybody has a phone in the hand. You don't know how much you're eating. The portion size is not in ideology, because we are fed so much. If you go to a restaurant, what do you see? The lights are always dim, correct? Why are the lights dim? Because you have no idea about how much is the portion size in your plate. It is always higher than what we require. Because we are going on eating, there is a starter, there is an appetizer, there is a main course, and then there is again something, and then you end with a dessert. Do you think as a normal person, if you were not conversing, or if the lights were not, if you are at home situation, you would have felt full? Because the environment in the hotel looks very, appealing, we kind of overeat. Same goes with the, when you're watching something and you're eating, you have no idea about how much, because your sensors and receptors have already sent a message by then that you're full, but you are still overeating. So to avoid that, try to finish your meal and then you can go ahead with your day. Eat without watching a phone. It will just take you at least 15 minutes to do so. Chew your food properly, at least 2 to 3 to 5 chews in the mouth and then swallow the food. That makes you realize that by then you are already full after some point, because we are just biting one or twice and then we are swallowing it. That is when we don't really get that senses going on point. Clear? Next, don't overeat, never skip your meals. I've already mentioned that 3 times. Going ahead, there are some of the locally available foods. So, but what do we go, let's say we go outside, but we look into different things. So there are things that have come into our Indian groceries like avocados, dragon fruit, lychees. So if you are going to the market, those are the fruits you would definitely think about. Oh, I'll take a dragon fruit. Oh, I'll eat oats. I want to lose weight, I'll start eating oats. These are not some of the foods that were there in our Indian menu or diet before. These are introduced later. Not necessarily that we have to consume all this. Consume locally available foods or the tropical foods, fruits that grow at this time. Papaya, chiku, grapes, watermelon that are produced in India. Not necessarily that you have to consume the foods that have come from out. These are also expensive compared to the tropical fruits that are available now. So consume locally. When it comes to non-veg, always try to consuming fish than chicken, and instead of red meat, consuming a chicken is better. Okay, but in what form of meat you are going to take, that is going to cause, because if you are frying it, then it's lost. The good amount of nutrient that comes from the protein is lost. If you are going to consume it in the less heat formed or in the gravy form, well and good. Next. So you need to consume the spices and nuts that are locally available, legumes, unhusked dals. These are the main components of our diet. Importance of water. We are drinking very less water. Do you agree? That 1 bottle of water you take to the college, that also you all don't barely finish it. That kind of 1 bottle you are supposed to have 3 times. It's a 1 liter bottle you are supposed to have 3 times. So make sure, and with the weather that is happening in Mangalore, you need to consume 2.5 to 3 liters according to your height and weight. Because it depends, your metabolism depends on water. All the other activities that is going to go throughout the day depends on the water consumption through the day. The electrolyte imbalance that happens. Why? Because you're consuming less water. Make sure you're consuming good amount of water. But we drink lot of juices and fizzy drinks that we get from outside. No. Yet you have to drink 2.5 to 3 liters of water. So 60% of our body is water. We lose water in sweat and urine. Yeah, like I mentioned, the weather is very adverse, and in Mangalore, if you are people who've come from other states, the weather is little humid here. Make sure that you're drinking proper water. Start your day with water rather than tea, coffee. Now, drinking warm water or empty one glass of water on your empty stomach is quite necessary to start your metabolism or give the boost to your metabolism. But what do we start with? Tea or coffee. I understand that there are a lot of people who say without tea or coffee my day does not go ahead. Yes, okay, that is some habit that you've got into, but make sure you're drinking 1 or 2 glasses of water and then go ahead with tea, coffee. Now the problem with tea and coffee is these contain something called tannins. When you consume it with breakfast, the nutrients from the breakfast cannot be absorbed because of the tea and coffee. You either have it 1 hour before or 1 hour after your breakfast, not with your breakfast. Tea and coffee is not supposed to be had with breakfast or with any kind of food because they are not good. They have some kind of anti-nutrient quality that they do not let the body absorb the nutrients from the food. Okay. Next, moving on. It also helps in preventing constipation and flushes out toxin. Because we are consuming less water, we have a lot of teenagers that now come to our clinic setup saying that we have constipation. Why is it happening? Because you all are not drinking water or not consuming enough vegetables and fruits. Vegetables and fruits basically have vitamin, minerals and fiber. Other than that, they don't give much energy or protein. So make sure you're consuming right amount of water through the day. So it is also, now water is also considered as a nutrient. Like you need to consider it and take so much amount of water. Before it was just a part of your diet. Now consume or water, it is considered as a nutrient. Next, white poisons. We all eat this a lot. Sugar and salt. And nowadays even jaggery and honey can be considered in it, because even though it is a better alternative, the kind of things that you get now is not right. The marketing strategies have come up with brown sugar and different kinds of sugars in the market, but make sure you're eating less of this because they're all going to be very toxic to us. So here sugars give only calories and nothing much. They have no protein. If the calories are not used up in the body, or if they're not, they convert into fat and get stored in the body. If you eat a piece of cake or 2 to 3 pieces of cake, and if you are just going through the day, if somebody's birthday is there and you go ahead with the day, that calories that is added up is going to turn into fat and get stored in your body. So make sure that you have an idea about portion control. We cannot say that don't eat cake or don't eat anything that has sugar, but have a portion control over how much you're going to eat. For an average Indian man or anybody, the amount of sugar that one person can take is only 5 grams. 5 grams is 1 spoon. 1 heap spoon of sugar, that's it. No more than that sugar can be consumed if you want to have a healthy, balanced lifestyle. But we do consume more than that, right? So have a setup about how much sugar you can have, and if you met the requirement for the next week or for the next few days, make sure that you're not having the sugar, or you're going to do half an hour extra amount of physical activity to burn the calories. Now as a student, I am pretty sure that it is going to be difficult to do any kind of physical activity, but half an hour walk is or can be done, or if you're in the room, having a skipping rope with you can also help. Something that you can do for 15 minutes where you're burning a lot of calories or sweating. This helps in increasing your metabolism and losing some calories for the day. Moving on. So no, some of the foods that are very salty or very sugary needs to be avoided. The different kinds of chutneys that you get in the market, ketchup or mayonnaise, also sauces, papad, sandige, salted dried fish, or even salted dried vegetable or canned fruits. Canned fruits is a thing. If you've seen, there are pineapples and lychees that are available in canned form in the supermarket. So anything that is highly sugared or preserved in sugar or salt, please avoid it. Moving on. There is a constant tug of war, whatever your mom prepares at home and what is there in the media. So there are all ads for Maggi, there is ads for Pepsi, and there are ads for different things. There are no ads that say about, I think once in a while you would have seen Sachin Tendulkar or Amitabh Bachchan say that, about 1 egg per day is good or things like that, which is from the government side. Otherwise they talk about how you can make this in 2 minutes and eat, or this is good, this gives you instant energy and things like that. So the tug of war is between chapati or the paratha that is made at home, the noodles and the breads that is available, and they are made of maida. The brown bread or any bread that you are going to take from the market here in Mangalore or is not wheat bread. Let me clarify to students, the brown bread is not a wheat bread. If you are doing it from wheat flour by yourself at home with an oven, then you can say it's a wheat bread. Otherwise everything here is just maida and brown color. Maybe 10% of wheat flour is added for the whole batch. There is no otherwise wheat in it. So that is the difference between what's made at home. There your mother is making it out of the wheat flour and she's rolling chapatis out of it. But here we are eating maida. Maida again is made from wheat, but it's the least processed food and it has nothing but just pure plain calories. So try avoiding anything that's made up of maida. Easy said than done. Yet there is lemon juice or milk or coconut water or buttermilk that's given at home. Immediately as you go, now you all might have come from your place to here to do your studies, but when you are at home your mother used to give all these the time you entered the house, correct? We've always said no, because nowadays it's different. We get pocket money, so we already eat and come home. But otherwise your mother is ready to prepare this and give to you, but you are not ready to consume this. You will be like, I'm already full, I ate my thing and I've come home, correct? So try next time you're home, at least ask her, or you can do it by yourself. It's more better than the fizzy drinks like Coke, Pepsi, or the carbonated drinks that you have in the market. Eat your vegetables, and media never talks about vegetable. Nowhere, no ads talk about vegetable. I think somewhere some noodles say that we've added vegetables to it, and when you prepare that, you never get to see any kind of vegetable in the processed food. We can eat a banana or any kind of fruit or chickpea. Groundnut chickpea is the best source of energy if you are outside and you want to feel your stomach. Chickpea is the best kind of snack you can get, other than the things that is available in the, now that after joining the institute you will come to know we have a variety of bakery items available in our setup. So either you can get a comparison of what is healthy and not. So whenever you see it, at least have an idea about, okay, this might not be good for me, I might be craving for this, but I can get a fruit or I can carry a fruit. I am not saying you cut a fruit and eat. Banana is easy to carry, you have to peel and eat. Orange is easy to carry, you peel and eat. There is nowhere where you have to cut the fruit or you need a knife or anything. Apple can be eaten just by that, just by washing it. So try at least having some fruits in your hostel room so that you can feel like, just rushing through, put that fruit in your bag and come. Even at that 11 o'clock, whenever you feel hungry, you can eat that instead of that. Or carry some chickpeas in your bag. That also is a good, because in chickpea there is groundnut and jaggery. Groundnut is going to give you protein, jaggery gives you energy. So it is a small bar that gives you around 80 to 90 grams of energy, like calories of energy, and it is better. I'm not saying it is good, I'm saying it is better than the other junk that is available. That is it. Moving on, but what do we get? Biscuits, kurkure, chips and other things that is available. Every food that is processed does have a date bar that it is going to expire on certain date. Whatever is prepared at home is fresh and can be consumed by you. If you read, you know, you all have to read now the nutritional label that is there in every packet. They write about what and all they add to it. Read it once, even biscuits for that matter, read it how much it gives. You will get an idea about how much is the maida in it, how much is the sugar in it. So have an idea about what, even the sugar drinks, there are fruit juices now they come, no, in canned form. Minute Maid and other brands that are fresh fruit kind of thing. Nothing is fresh in that. It is 12 months old juice that is done and kept in preservatives. And it will have max around 20 to 30 grams of sugar in one bottle. That is almost half cup of sugar. So kindly be careful when you are consuming those canned juices that you think is healthy. Moving on. So I'll show you some slides about 2 plates. They are going to have a healthy and a non-healthy, but they'll kind of give the same count of calories, for example, or this one gives a better calorie count. Yeah, this is a small amount of French fries, and there you have more than 200 grams of fruits. Now this French fry, you can have one more portion of it, correct? We can go with one more portion of French fries, but I can assure you, you can't finish that one plate of fruits. We might need 4 to 5 people to finish that one plate of fruits, but we can go with 2 more portions of this. But that is less than 100 calories, and here we are shooting up to 500 to 600 calories. That's the difference. This is giving you 500 to 600 calories. There we are with less than 150 to 100 calories. Do you see the difference? You are going to feel full for next 3 hours with the fruits, and you will feel instant hunger in next 1 hour. Moving on, the next plate we have is Doritos or nachos or anything corn chips based. That is from one packet, and that is the fruits, that is 3 apples to 2 apples, that's cut. You can finish this in 1 minute, that you will still take time eating that apple. Okay, moving on. Your potato chips is instead of that you can have the sprout chart, which is equally healthier, but that is going to only give you 80 calories, and this is somewhere around 350 calories. See the difference. You will not be able to finish it, or with that one bowl of sprout chart you will feel full, but you will still not be full with this bowl of chips. Next, the paisam that's made at home nobody wants, but we all want the dessert as a cake or a cheesecake. Cheesecake is now on trend, no? Everybody wants to consume different kinds of cheesecakes. So, but whatever you're having at home, and the desserts at home are better than what's done out. Moving on, some of the food myths would be consuming protein powders and whey is going to help me gain weight or helps me in my gymming, or I have to have probiotics to feel better about myself. Multivitamin tablets has to be consumed. If it is not recommended by the doctor, please don't go ahead with consuming multivitamins over the counter. Okay, carbs are always bad, so there are keto diet that always talks about completely avoiding carbohydrates and taking fat as a source. Carbohydrate is not bad until you are consuming the right kind of carbohydrate. Clear? Moving on, probiotics are good, not always. Heart healthy oils. There is no oil that is good for heart. I've had a patient who's consumed, because somebody has told that olive oil is good. Now olive oil is not something that is produced in India. It is got from outside. And the patient, somebody's told them that olive oil is good. The patient is consuming 20 to 10 ml of olive oil daily because it is good. No oil is good. No rice bran oil, no coconut oil, no, every oil is the same. It depends on how much you're using it. Moving on, hot and cold concept. We don't follow the concept. It is there in Ayurveda, but when we are in our clinics, we don't follow that. If you eat this food, it is going to cause cold to you. If you eat this food, this is going to cause cough to you. We don't believe in that system. Moving on, eat intermittent fasting. Eating only once in a day. Please, if you have any doubts regarding different kinds of diet you've come across, some Instagram reel or some YouTube video or somebody who's saying random things, come to the dietary department in the hospital or any good doctor or the faculty, talk to them about it, then go ahead with diets. You think it is very, easy to follow a diet? No, it is not. It has adverse effects as well. Before you try, it's better you come and talk to your faculty or someone who knows about it. We can guide you. Moving on. So, if we don't follow a diet, there are consequences. So, there are lifestyle. So, there is nothing called a diet. We are going to only follow healthy lifestyle. That is, the minute you put diet in your mind, you think there are some restrictions. There are no restrictions until you eat it in portion control. But there are some lifestyle diseases. If we don't maintain our healthy life, we are going to get. Main things are diabetes, hypertension, and we have cardiovascular diseases, obesity, cancer. So these can be caused if your food is not on point. If not now, some other day. So to avoid all this, it's better to have home food. Clear? Next. Yes. Yeah, we can talk about it once I finish the session. You can ask that. Whey protein, as in you don't have to consume it to gain weight on the gym. You can consume food that's made at home and yet get the results. Can anybody pass him a mic or something?
Whey protein contains many minerals and proteins that we can't get from our food.
Hi, what's your name?
Shazin?
Yeah, Shazin. Actually, are you not consuming food at home?
Yeah, I consume it.
And there are no nutrients in your food?
Yeah, but many of the nutrients are not getting from our food.
Why?
Because there is nutrients that we get from the food.
No, you're wrong. That is where you're wrong. You don't exactly need a protein.
How can we eat the food that it's contained?
How can you?
If it says that one day we should get this much protein, this much minerals and this much vitamins.
Okay.
Also, like the baby food like Cerelac. Yeah, the ad on it. Remember the ad on the Cerelac?
But Cerelac is not consumed by you.
No. Do you remember the ad that it's in Cerelac? The doctor says that there are many foods that can eat for babies, but they all took in that one scoop of the Cerelac powder.
No, you've got the whole ideology wrong about Cerelac or any other complementary food. You can take a session from me where I can tell you what.
No, I am not taking section. I am asking a doubt.
I'm asking. No, I'm not saying that. No, you can take a session as in a personal session with me in the hospital.
I am not judging you or I am not proving that you are wrong. I am just asking a doubt.
Yes, exactly. I am trying to say
and
you
also,
that.
There are many of others who has this same doubt and they are also want to talk about this.
Yes, but whey protein is not the right kind of protein. When you get protein from the food, consume that and you don't need an extra supplement to build your muscle, is what we are trying to say. Whey protein basically, even in whey protein, the multi minerals and vitamins are not from the whey. It is from another source. That is what I am trying to say. If we give a diet plan where you can get 80 to 90 grams of protein from food, then taking a supplement is not must. And Indian way of gaining weight, even way before whey came, we did gain weight.
Yeah, but they had to eat 4 meals or 8 meals one day.
Yeah.
They had to eat 8 meals actually.
Yes. An athlete does not go for whey supplement, trust me. Even in our Indian athlete system, we don't go for whey.
You think
it's
that
just
a person can eat 8 meals a day?
Can,
nowadays?
why not? Why not?
How?
Every
Like-
second hardly. If 8 o'clock you're having your meal, and 11 o'clock again you're supposed to have a meal, and lunch again, and then mid-evening around 3 to 4, 7 and 8, and 12, somewhere around 9 in the night. So this is the whole setup.
If we are in the class, we have to take at 8 o'clock we have to take our breakfast, and at the interval period we have to eat also. So how can we get that food?
You have to
Like
pack your meal.
Yeah, we have to pack that meal also. So we have to pack 2 meals
Yes.
for evening section and morning section.
No, evening session you're going home and having, no?
No.
But now, right
yeah,
now your issue is
after-
you're in the hostel.
After the lunch, we
Yes.
have to take.
Yeah. 3
Okay.
to 4.
Yeah,
Ah.
I told you 8 sections. There are 8 meals.
No, you've got the whole system wrong. We need to check your height, weight, accordingly see
Yeah.
what kind of physical activity you're doing. According to that, we calculate your calorie, protein intake, and then we said, I didn't mean a session as in session. I meant a personal session where in the hospital we talk to you in person. But my talk as a dietitian, whey protein is not necessary to get the right amount of protein for the day if you are going to increase your muscle mass. So you need not get offended with the fact that whey protein is not good, but it is not good. Do you get my point? Okay. No, but I'm really glad that there are people out there who think whey protein is necessary. You don't need whey protein. The point is that Indians, even before whey was introduced to our system, we've had the best athletes and best muscle gain with just use. Do you know something called, in Mangalore we call it Goda. We use a wooden weight and try to do it. It's also there in Kerala setup also. Do you think they consumed whey? Do you know how ripped they are? The muscle content in their body is so better. Why is that? Do you think they consume whey? Even till now, if you ask anybody from the local setup how they consume, whey protein is a marketing strategy for gym people. Whey protein is a marketing strategy where they talk about increasing their line of, there is nothing that is going to be great for you. If I can give you a diet menu where I can give you the right amount of protein that can come from food, yeah. I understand as a student right now that's not possible for you. Moving on. Is there a cure for all these chronic diseases? So usually there are no symptoms until it comes to a full-blown effect. So we need to be careful on our daily basis. Not every patient has all kind of typical symptoms. So no, not everybody will have a certain same kind of characteristic. So when symptoms actually develop, the disease fairly progresses. So the prevention is better. You can look into the risk factors, the progression of the disease, complications, and also death. India is ahead in all terms. We are actually topping the chart when it comes to diabetes, hypertension, cancer. So let's move on. So the risk factor when it comes to diabetes, hypertension, and all the lifestyle diseases, they are also called as non-communicable diseases. So the 4 important ones are unhealthy diet, less activity, and tobacco consumption, and harmful use of alcohol. Even tobacco and alcohol is also going to aid to all these non-communicable diseases. The physical activity, you need to at least do 30 minutes of physical activity in the day if you want to consume, have a normal, setup. If you want to lose more, then definitely 45 to 1 hour of practice has to be done. But to lose 1 kg of fat, you need to burn 7,700 calories. Clear? And if you consume, for example, 3 Parle-Gs in a day, it is going to add 100 calories extra with what you are having, and that is going to take 5 kgs in a year. So you are going to gain 5 kg weight if you just consume 3 Parle-G biscuits. Okay? So that is just a rough idea. So make sure that you're having a 30-minute walk or any kind of activity where your cardiovascular pumping is higher. Next. So tobacco, now we'll talk about 2 problems. The first one is tobacco. India is the largest producer of tobacco. There is 25% male who consume tobacco in India. The problem is also second-hand smoking. So when you are sitting next to someone who's smoking, even that is more harmful than the person who's smoking it. Okay, but the conflicts are that we can't stop it in India because of the policy, and then there are people who are producing it, and it is giving a mass employment to a lot of people. So there is a clash between that, but yet I think tobacco should be banned all over India. Now the Indian scenario is 1/3 of adults use some form of tobacco. Every 8 seconds, one tobacco related death happens in India. So the tips to quit is 4 A's, the 5 D's and 4 R's. That is avoid, alter, the alternatives and the activities. The 5 D's are deep breathing, delay, drink water or do something and discuss about it. The 4 R's are review your reasons of deciding to quit, remind yourself, write out the decider and reward yourself. Moving on, alcohol. The harmful use causes more than 200 diseases and injuries all over. There are 6% of all deaths happening due to alcohol. In 20 to 39 age group, there are 25% death happening by consumption of alcohol. And 1 ml of alcohol can give, 1 gram of alcohol can give around 7 kilocalories. So it is giving good amount of calories as well. So make sure that you are very, better not consume these two, tobacco and alcohol. Moving on. So what about the non-alcohol drinking? Equally bad. So we have all the fizzy drinks, there are energy drinks that are there in the market. Kindly avoid. Instead of that, why don't we try? But like here, the McDonald's or KFC setup has something like the Pepsi, Coke, something comes with the food. You go to the theater, there is a big jar of Pepsi or that you feel like consuming. Why do they keep a popcorn and a fizzy drink in this? Because popcorn are kind of, and they start popping the popcorn or reheating it so the smell comes out during the interval time. So you feel like going and buying it. So make sure that you are, eat a meal before going to the theater. That's the best thing. Here, so there are high levels of sugar. You can actually read the nutritional facts. 1 tin can of any beverage will have 30 to 40 grams of sugar in it. And the phosphoric acid in the fizzy drink can damage your enamel and the tooth. And high sugar and sodium can actually dehydrate you. The minute you drink a fizzy drink, it's not going to quench your thirst. It's going to make you feel more thirsty. Junk food eaten along can lead to obesity. Obesity can also lead to diabetes. The more fat in the body gets deposited, the insulin resistance happens in the body, because the insulin released by the pancreas is not enough, because there is more fat deposited around the body. So we need to make sure that we are in the right category. Affects cholesterol levels in the body. Now what happens is, cholesterol is produced in the body and we are taking cholesterol from food. So make sure that that cholesterol is lesser what you're taking from the food. Moving on, it can also cause lot of gastric related issues. The heartburn that you're getting, or you don't feel like eating, or reduced appetite, they can all be because of carbonated drinks or your sugary drinks that you're consuming. Ill effects of appetite in children is seen because of consuming these sugary drinks. So these are some of the alternatives that you can consume, like milk, buttermilk. There is fruit juice that's made at home. And if there is a setup we have in our diet setup, that is, eat your fruits, make your vegetables into drinks. Don't ever make a juice and consume fruit, because the minute you make a juice out of it, you are going to strain it. You are adding so much sugar so that it becomes better to drink, correct? Then you are straining it. So you are basically just drinking sugar. So make sure you are eating your fruits, making your vegetables into juices. Okay? Yeah, thank you. You can come to the dietary department in the hospital and we can have a talk on which whey protein, and I will show you what's the content in whey protein and how it is going to work, and give you a diet chart if it helps you. Okay. Any questions? Any further questions? And I'm sure you might have a lot of other things about BCAA and the creatine also that you are consuming with the whey protein. Other questions regarding the different kinds of diet or something that have come across?
Thank you, ma'am. That was really an enlightening session for the students. Hope they will take the positive cues from this. Now I request Ms. Chaitanya, ma'am, to give away the token of appreciation to Ms. Harshita. Thank you, ma'am. Thank you. In today's competitive academic environment, stress among students has become a prevalent issue. However, it's essential to recognize the stress when managed effectively can be a powerful motivator and a catalyst to a personal growth. Dr. Shashwat Satyanath, Assistant Professor in the Department of Psychiatry, will explain us how we can find calmness in the chaos and cope with the day-to-day stress. I request Mr. Manish from Clinical Psychology Department to introduce our speaker.
Thank you, ma'am. Dear students, teachers, ladies and gentlemen, it is my privilege to introduce Dr. Shashwat Satyanathan, a consultant psychiatrist whose impressive credentials and dedication to the field of psychiatry have made him a leading figure in the realm of mental health. Dr. Shashwat holds a MBBS degree along with MD, showcasing his strong foundation in medical sciences. He is also a proud fellow in the Indian Psychiatric Society, a testament to his commitment to advancing the field of psychiatry. In his esteemed career, Dr. Shashwat has been a driving force for positive change in the medical community. He is currently serving as an assistant professor in the Department of Psychiatry at Yenepoya Medical College for the past 5 years. This role not only demonstrates his expertise, but also highlights his dedication to educating the next generation of medical professionals. As Chief Consultant Psychiatrist at KIMS Sunrise Hospital in Kasaragod, Dr. Shashwat plays a pivotal role in providing crucial psychiatric care to the community. Dr. Shashwat's clinical experience spans over a decade, including roles such as Junior Resident in Psychiatry at Yenepoya Medical College, Senior Resident at SDM Medical College and Hospital in Dharwad, and Assistant Professor of Psychiatry at KVG Medical College and Hospital in Sulia. His main areas of interest lie in social psychiatry and de-addiction psychiatry. His doctoral thesis on stigma and discrimination in psychiatry reflects his commitment to addressing the societal challenges associated with mental health. Dr. Shashwat's contribution to the field extends beyond clinical practice. He boasts an impressive portfolio of approximately 12 publications in national and international journals, as well as co-authored chapters in textbooks on topics such as behavioral addictions and clinical decision-making in psychiatry. Furthermore, Dr. Shashwat is currently pursuing the MRC Psych degree to become a member of Royal College of Psychiatrists in the United Kingdom, a testament to his commitment to continuous professional development and global collaboration in the field of psychiatry. Dear students, please join me in welcoming Dr. Shashwat Satyanath, a distinguished psychiatrist, educator, and researcher whose work is making a profound impact in the field of mental health.
Good morning all. It's good afternoon or good morning? Yeah, good morning. Okay. So, this is your 4th day of your Deeksharambh course, right? Okay, so how many of them are stressed here? I'm sure almost 99% of you are stressed. Am I right? Okay, so stress is inevitable. You can't avoid it. You will invariably face stress in your day-to-day situation. Can you guess what is this? You can see this diagram, no? Picture, what is this? Yeah, this is my schedule on a day-to-day basis. I come from a place called Nantur. Okay, so when I have to go in the morning, I have to cross this Nantur junction. It's known for heavy traffic. So here I am supposed to reach by 8:30. If I am delayed here, I will lose my salary. My leaves may be cut from the college. So it's a stress for me. So same way everybody will be facing stress on a day-to-day basis. So you'll have to come by college, you'll have to get up in the morning. So in the college you might be having some exam, some assignments. So some or the other presentation might be there. So it's a stress for you. So you can't avoid it, right? So it's not the stress that kills us, it's the reaction to it. So life is 10% what is given to us and 90% how we react to it. So it's important how we deal with the day-to-day situations. Either you can crack and fall or you can fight and deal with it, right? So suppose for every stress there is a solution. Every problem has a solution. Suppose if a person has a headache, what do you do? If a person has a headache, what do you do? What is the solution for it? You take some analgesic, painkiller. Suppose, so that is a way to deal with the headache, stress. So suppose if he has a headache because of some underlying cancer, so what do you do? Can we change it? We can't change it. We need to accept that situation. So either you adapt to the situation or you can accept the situation, right? So what is stress? Stress is body's automatic response to any physical or mental demand placed to it. So we might be facing some kind of threatening or a harmful stimuli. So our body will adapt to it through some physiological and emotional changes in our body. So one of the chemical known as adrenaline is produced in our body, which can cause some kind of physiological changes in our body. Suppose now you are all sitting here. Suddenly there is a snake next to your chair. What do? You see a snake next to you. What do? You get scared. You become fearful. So what happens during that time? Adrenaline gets produced. So what happens when adrenaline produced? You will have a fight or flight reaction. Fight reaction means either you might suddenly throw something on it or you might escape from that place. You might run away from that place. So that is mediated by adrenaline. Okay? So what happens when there is a fight or flight situation? There are some changes which happens to your body. So your pupils get dilated. Your heart rate gets faster. Your BP starts shooting up. Blood pressure starts shooting up. Your muscles start getting tensed. And you will have a dryness of mouth. You will have profuse sweating. These are the changes which happens to our nervous system because of stress. Okay? So stress means feeling troubled by life. It can happen to anyone. It can happen to a young child, to a old age group. It can happen to students, it can happen to doctors, it can happen to celebrities, it can happen to anyone, at any age group, at any point of life. So what do you think, stress is good or bad? What do you think, stress is good or bad? How many of them say it is bad? How many of them say it is good? Stress is good, how many of them say? So, stress can be good also. So, it all depends on the level of stress. So, everybody needs to have a moderate amount of stress. Why is that? If you have a moderate amount of stress, you can perform better. Right? So, if you know that after 1 month you have an exam coming up, or after 15 days you have an exam coming up, what will happen to you? You start becoming serious. You start becoming stressed. And what do? You start reading more. Right? So a moderate amount of stress can always improve your performance. What will happen if you don't have stress at all? You have an exam coming up after 2 weeks, but you are not at all bothered about it. There is no stress at all. So you become careless. You become irresponsible. You stop reading. Right? So stress is always not bad. Okay? So there is something called eustress and distress. So if it is an eustress, that is good. Distress means it is bad. What do you mean by distress? Distress means the stress which is of higher level. That can impair your performance by causing lot of anxiety and depression. Okay? So moderate amount is good. Okay? So it can happen at childhood, adolescence, adult, at any point of your life, even during marriage, delivery, pregnancy, during divorce, during the death of someone, any physical illness, at any point of life it can happen. Because life is full of ups and downs. It is not always same. You might have seen ECG, no? ECG has lot of peaks and waves. Same way, life is also like that. It's all ups and downs. So a lot of these major causes can cause stress, okay? So life events, change or loss of job, illness, change of residence, change in the quality of life, all this can cause stress. Okay? So some of them can be major threats like abuse. It can be physical abuse, emotional abuse, sexual abuse in childhood. It can be family violence, some illness. Some people may be diagnosed with cancer or some autoimmune disease. They might develop depression, anxiety. Sometimes even not doing anything can cause stress. Like for example, 3 years back you had COVID. So you had lockdown. So you had to stay at home without doing anything. So not doing anything for a prolonged period of time can cause stress. So what happens when there is chronic stress? I can give you one example. Yesterday itself I saw one patient, a married lady. She came to me with a history of 5 years of insomnia. She is not able to sleep since 5 years. Daily she is not able to sleep. She has dark circles around her eyes. So, and she also reported of emotional swings, mood swings. Whenever she is married, so whenever husband tells something or in-laws tells something which is not very major, something minor, she becomes very tearful. So she can't control her emotions. So when I probed further, she didn't tell any other complaints, only headache, mood swings and sleep disturbance. When I probed further, the history I got was she got married in first PUC. So till she studied till 10th standard. So first PUC she couldn't complete. She got married at that time. And her marital life is very good. Her husband is very supportive. In-laws are very supportive. Everything is good. But when I probed further back retrospectively, what history I found out was her mother has a twin sister. She looks like just like exactly her mother. So after she was born, at the age of 3 to 4 years, her mother gave this patient to her twin sister to look after her, because mother already has two children, male children, and mother was the only earning member in the family because patient's father had alcohol problem and he was very abusive. So mother couldn't manage everything. So mother gave this patient when she was young to the mother's twin sister, because mother thought they look alike, so she will take care of this patient like me. That's what mother thought. Then the patient stayed in twin sister's house throughout these years. What happened there was severe physical abuse, emotional neglect. So till the age of 3 to 5 years, the twin sister, the mother's sister, took care of the patient. But after that, she was made to work like a maid there, because that twin sister had a daughter. So she only took care of her daughter, and this patient was neglected completely and was made to work as a maid till 10th standard. So she was assaulted throughout the childhood. She was beaten, her head was hit on the wall, and there are bruises because of that. So she underwent a severe chronic trauma till 10th standard. So because of that, now after marriage she is not in touch with those people. But after marriage, now what has happened is, whenever some kind of criticism happens from husband or from the in-laws, that triggers her old memories of abuse, and that causes her to weep a lot, cry a lot, and then she can't sleep in the night. So this history I got. So that chronic stress throughout the childhood has caused her to have mood swings and insomnia. Got it? So such kind of chronic stress can cause physical symptoms, okay, like weight gain, weight loss, unexpected hair loss. You might have seen in your relatives, among your relatives, some kids, if they are children, if they are there, when the exams are nearby, they'll have a lot of mouth ulcers or bowel irregularity, loose motion. That is because of stress. Stress can cause these kind of physical changes. Heart palpitation, high blood pressure, right? So usually we get a lot of reference from medicine department or cardiology department. Most of them have some kind of cardiovascular disease and high blood pressure. But if you look at most of them, almost all of them will have associated anxiety. I had a patient in my clinic where BP was always in the range of 180, 190. It was never coming down. So the physician put on 2 antihypertensives to lower the BP. Still the BP was not coming down. Then they referred to me, and what I found out was she was severely anxious. Then I had to do some counseling and give some medicines for that. And now her BP is stable. So BP is like normal now. So sometimes chronic stress can cause increased blood pressure. It can cause emotional changes like mood swings, as I mentioned. Anxiety. So many of them, especially when they have chronic stress, they can develop some kind of phobias, anxiety disorders, social phobias. Good example would be, like many of them in this, like among us only, so many of them will have social phobias. Social phobia means a fear that what will others think if I talk, will somebody criticize me, will somebody make fun of me, this kind of fear might be there. Why does that happen? Why does social phobia happen? Because somewhere during your childhood, somebody might have ridiculed you. Like for example, when you are in a function, maybe there were some relatives who didn't like your parents or yourself, who are not in good terms with you or your parents. So you might have performed some act in a function. You might have sung some song, or you might have given some talk in a function. But those people might have made fun of you that you have not done it well. So that can be left, that can leave an imprint on your mind. Okay, this person has ridiculed me. I am not good enough. So that causes an impression in your mind, which can later turn into a phobia, social phobia. So it can lead to depression. It can also lead to, sometimes when there is lot of stress, what happens? You might go into a maladaptive or poor adaptive coping skills. There are good coping skills and bad coping skills. So when you are stressed, many of us, what they can do, they will go to watch a movie, they will listen to some song, or they will go for a walk outside. But some of them, they might go into some poor, unhealthy habits to cope up with this stress, like drinking alcohol, smoking. We get a lot of patients who tell that after smoking, I smoke because I'm very anxious. When I smoke, I feel better. So that is a kind of a poor coping skills to deal with stress. So everyone experiences stress at any point of time. So they can develop lot of complaints, physical complaints, headache, lump in the throat, pain everywhere in the body, stomach upset, tight muscles. We get a lot of patients in our OPD, psychiatric OPD, with pain everywhere in the body. So they go to orthopedics, they go to physiotherapy, they go to medicine, they go everywhere. But they will do all the investigation, everything is normal. Ultimately, they will refer to psychiatry. Vague complaints, refer to psychiatry. When you take history, most of them will have a lot of stress. It may be familial stress, financial stress, some kind of stress. So that triggers this body complaints. Okay. There was one patient who came to me, one girl. Okay. So she was a 10th standard girl. Okay. Only complaint was headache. She was having headache and not going to school. Okay. She was staying in hostel. So from the hostel, they sent her back home because she doesn't go to school and she has severe headache. Headache is unbearable. Okay. And they referred to neurologist. Neurologist did MRI, all the imaging, everything is normal. And they give some painkillers, but headache is not coming down. And then they refer to various other doctors, but headache is still there. And she stopped going to school since past 2 months. Not going to hostel also, she is at home. Okay? Parents are really worried, what is happening? Why is it not coming down? And then finally, after every visits, they came to psychiatry. Okay? So what I found out was, 3 months back, before the onset of headache, when she was staying in a hostel, she wrote a letter because she has a teacher in the school. She likes a teacher as a token of respect and not as a lover, but as a feeling of respect. She likes that teacher a lot. So what she did was she wrote a letter to herself, but in the name of teacher. Dear teacher, so and so. Then she wrote some big letter and she kept it in the hostel room in one of the books. And her roommate, she opened that book and she found out that letter, and this roommate started making fun of her. That you are having a relation with this teacher. And then they reported to the warden. Warden came and warden found out, and hostel warden scolded her. Okay? And after that, she started getting very upset, feeling very guilty, depressed, but she didn't tell this to anyone. She didn't tell this to her parents. She didn't tell this to anyone. And then the headache started. And she didn't want to go to school because she has to face everyone. She has to face that teacher also. So she didn't inform everyone. She started getting severe headache. So this history I found out because of stress. And then this was dealt with the help of teachers and all those things. And she improved after a few sessions. And she started going to school. So what I want to tell is, sometimes these physical complaints can be because of stress. Okay? Many of them, especially students, can develop difficulty in focusing in subjects. They can't focus on reading. They cannot sit still. They start getting irritable at family members, at the friends, okay, towards the friends. Then they start crying. Then they can have change in the appetite. Many of them, what they do when they are stressed, they don't want to eat. Some of them can eat a lot. They eat a lot of chocolates. Okay. Some of them, what they do when they are stressed, they start watching Netflix, Prime Video, Hotstar. They start watching lot of serials. In the night, they start watching all these serials and they don't sleep at all. Okay? These are all poor way of coping up the stress. So what is stress management? Stress management is a set of techniques which can help in dealing with this kind of stress by analyzing it and taking positive actions. Okay? Yeah, so as I mentioned, stress is not always negative. A moderate amount of stress can increase performance. It enhances concentration, keeps us going, some amount of stress. So don't think of stress as a threat, demoralizer, pressure, overwhelming or debilitating. So don't focus on the problems, don't fight stress. Instead, think it as a challenge. It's how you react to it. Think it as a challenge. Think it as a motivator, as an opportunity to improve yourself. Do focus on possibilities or opportunities. Okay? So suppose you are now studying, no? So you might get lot of opportunities. Like some people, sometimes you might get an offer for a scholarship. So don't take it as a stressful thing. That, oh, I'm getting a scholarship. No, I'm getting an opportunity for a scholarship. So will it be a stressful thing? Will I have to read more? How will I read it? How will I cope up with it? Instead of thinking like that, think it as an opportunity to improve yourself. So try to embrace the stress instead of thinking it as something very problematic. So you can't avoid stress. In every day you will have a stress. See, I am from Kasaragod. So I work in Kasaragod. So I have to travel daily up and down. Okay. So many of you know how Kasaragod roads are. So whenever you travel, many of them overtake you. Many of them don't allow you to go on the side. So these things can happen. Suppose you imagine a scenario like that where you are driving and suddenly somebody overtakes you and goes in very fast and overtakes you, and he is in front of you and suddenly he slows down. So he is blocking your way and he is going very slowly in front of you. So what is the natural reaction? You start honking, you start scolding him, you start showing your hand, and you start telling him to go fast. So you start becoming very irritated, angry at that person who is in front of you, right? That is a natural reaction. So you would say, idiot, at top of the lungs. You would be irritated. You will have negative thoughts about that driver. What kind of person is he, right? So this is called fight or flight response. Either you will start fighting with him or you will also try to overtake him, right? So always for these kind of scenarios, this is just an example, you can give a positive interpretation. Like maybe that person is in some kind of trouble, right? So maybe he's not focusing, he's in some kind of problem, or one more thing you can think that I am not in a hurry. Why should I be in a hurry? I have a lot of time. So I can take my time and I can be slow. That is one way of thinking. Okay. Another way of thinking is, think that suppose you have at your home you have a lot of kids, no, children at your home. So what do you do? If children do some mistake, you try to forgive them, right? If a child does some mistake, you forgive them. Same way, why don't you think adults as a grown-up kids and forgive them? Think of adults as some grown-up kids who can do mistakes and learn the art of forgiveness. Okay? And also, you can always think that maybe that person who cut you in front, he was rushing to a hospital because he got a news that his mother is not well and mother is admitted in the hospital. So that is why he was driving very fast. And then he overtook you and he is in front of you. And suddenly he got a news that his mother expired and he is in a shock. So that's why he slowed down in front of you. So what I mean to say is, we should always think in others' point of view. Okay? Don't be self-centered and think about yourself. Think about what others might be going through. Think in their shoes also. Okay? Then you can avoid such stress. So think, have a positive interpretation about everything. Okay? Suppose many of them have close friends here, best friends, and suddenly one of your friend is not talking to you. So what is the natural thinking you have? Like for example, you have a close friend, one of you, and suddenly one day when you are with him, he is not talking to you at all. So you start feeling bad, and then you start thinking, why is this friend not talking to me? Did I do something bad? Am I that bad? Why am I like this? Why I am not lovable to him? So you start thinking like this. So instead of thinking like this, you can always think an alternative way. Like maybe that friend is having some problem at home. That friend is worried that his parents are not well, or there is some financial issues at his home. So maybe I can ask him that, what happened to you? Why are you not talking to me today? Is there anything wrong with you? You can always ask that to your friend instead of thinking that he doesn't like me. So always have a positive interpretation for each and every situation. Also, you can always tell that he has overtaken you. That is not a bad thing, because what if I also try to overtake him again and I might face an accident because of that. So whatever happens is for good itself. So whatever has happened is not a bad thing at all. So protect yourself. So whenever there is a stress, there are a lot of techniques which we can do to protect yourself from developing the stress. Find a support system. So whenever one of you is facing some kind of trouble, you can always talk to your friends, your family, your relatives, your teachers who are sitting here, your counselors, because if at all something is bothering you, if you talk to them, it will, you are venting off something from your chest. You will feel much relieved. You will feel much better when you start discussing with others. So always find a support system. So change your attitude. For everything, there is a solution. So life is, as I mentioned, 90% of how you react to this individual situation. Be realistic, okay? So what you need to think is, suppose now you are in a course, many of them are in physiotherapy, some of them are in psychology, so everybody are in different course. So it is totally different from what you study in 10th standard or 11th standard. Because once you are in this course, the subjects are much more, right? You will have lots to read. So it's like a vast ocean, right? It is not possible to complete everything once you are in a degree course. So you have to be realistic about it. You have to know what to read and what not to read. So you can't go on reading everything because it's not possible to complete everything. So you should know what are the questions which are going to come in the exam, what are the important questions, what are the topics to be read. Some of the topics may not be important, so you can choose to not read it. So you should know what to do. Okay, be realistic about it. Get organized and take charge. Okay, because this is very important, because don't wait till the exams are nearby, because what will happen is if you don't read now and when the exams are nearby you start reading at that time, that can cause a lot of stress. So you try to develop a habit now itself where you spend at least 1 hour for studies. So make it a part of your schedule. So get an organized way of living, okay? Like getting up at 6 a.m. or 7 a.m. in the morning, then getting ready, going to college, coming back, then doing some gym activities, then keeping some time for studies like 1 hour, then spending some 1 hour for yourself doing some extracurricular work. So organize your life in a way that is followed every day. So if you do that, what will happen is the stress will be less during the exam. Take breaks, okay? See, because it's not possible for you to read continuously or do your homeworks or assignments continuously. What you do is, when you are in the evening hours, take at least half an hour time for yourself. Spend at least half an hour or 1 hour time for yourself. Some of you might like singing. Some of you might like music. Some of you might like to draw something. Some of them might like to write some poems or novels. So what you do is spend at least half an hour time for yourself. What will happen is that will improve your confidence. That will energize your brain. Okay? That will boost your morale, because you will be doing something else which you like. That will be your passion, right? So that can actually act as a stress buster for you. Take good care of yourself. Your previous session was on diet, right? So it's important you follow a good diet, good exercise routine, good sleep pattern. Have at least 7 hours of sleep daily. So try to have a fixed pattern of sleep. Like for example, 11 p.m. in the night to 6 a.m. in the morning. So have a fixed pattern of sleep, because sleep is very important for you. Because what happens is, what will happen if you use laptop continuously? If you use laptop continuously, what will happen? It will heat up. Or if you play in a mobile continuously, it will heat up, right? It will start burning. Same way, if you do activities continuously, either reading or watching TV or mobile, it can actually cause a lot of, it can drain your energy. So how you switch off your mobile or switch off your laptop, same way, you need to switch off your brain also. So sleep is very important in the night. So have at least 6 to 7 hours of sleep in the night, okay? Always learn to say no, okay? This is known as assertive skills, okay? Assertive skills means, suppose you are a person who doesn't like to say no to others. What will happen? Everybody will start misusing you. They'll start taking advantage of you. They'll start giving a lot of work to you, and you will be burdened and you will be stressed about it. So learn to say no to such things. You need not take a lot of what is that? You need not accept everything from others. Many of them might ask favor from you. You can always say no. Saying no doesn't mean that you are uncaring or selfish or you're bad. It doesn't mean that. It just means that you are overburdened and you are taking care of yourself. So you can always say no in a firm and polite manner. Politely as well as firmly. Okay? That is called assertive skills. So have regular exercise. So many of you might be going to gym. So, or it need not be gym. You can do skipping, you can do running, jogging. Morning you can take half an hour for walking. So this can actually help in reducing stress. Have a hobby. So now you are in a course, right? So in your campus, you have a lot of clubs like art clubs, literary clubs, music club. So you'll have a lot of extracurricular clubs will be there. If you are interested, you join in such clubs, because if you join, that kind of extracurricular work can actually help in reducing the stress. Okay, it can improve your confidence. And slow down. You need to know your limits and cut down in the amount of activities you do. You need not complete everything in a day. Suppose in a class, lot of assignments are given. You need not take lot of pressure and do everything in a day. You can divide yourself that I will do this particular assignment today. Tomorrow I will do this assignment. You can divide and do. Don't take everything in a day. Okay? It can cause a lot of stress. Laugh. Use humor. Many of you, when you are stressed, they start cracking jokes. They start watching some funny videos, reels. They start watching comedy shows. So this can help as a stress buster. You can do all this. So you can always try some kind of relaxation exercise like yoga, meditation, breathing exercise. This can help in reducing the stress. Okay? There is something called deep breathing or meditation, where you start practicing inhalation and exhalation on a very slow pace. Okay? When you do that, it can actually cause a lot of relaxation to your mind as well as muscles. So whenever you are stressed, you can practice it in your hostel or in your classroom also. So what you can do is just close your eyes and take a deep, slow breath inside for a count in your mind for 8 times or 9 times, and like count to the number of 9 and take slow deep breaths inside and hold that breath for 5 seconds, and then you can slowly exhale for a period of 8 seconds. So inhale for a period of 9 seconds and hold the breath for a period of 5 seconds and exhale slowly and completely so that lungs are out of air for a period of 9 seconds. So you do that continuously. What will happen is it will relax your mind. It will reduce the adrenaline rush in your body, in your brain, and it can relax your brain and as well as muscles. Okay? Improve the time management. This is also very important. So there will be a lot of tasks which are given to you. Like you need to complete this, you need to complete that. So what you can do is you can divide your task. What is very important and what is very urgent, you do it first. Okay? What is not important, what is not urgent, that you do it last. Okay? Suppose you have a assignment day after tomorrow. That is very important. You have an assignment next week. That is, you can do it on a later stage because that is not important. So assignment which is there tomorrow has to be completed first. So you can prioritize your task like that. Okay? So what is very important and very urgent has to be completed first. What is very important, what is not important, what is urgent can be completed next. Okay? So you remember, what is important and what is urgent has to be completed first. What is urgent and not important can be completed next. Okay? And what is not urgent, what is not important, that can be completed last. So you can prioritize your task in such a way. That is called time management. And always you can shift your work. Suppose, I don't know, many of them have many other subjects, right? So don't get stuck onto one subject in a day. Suppose if there is anatomy subject, you don't have to read anatomy throughout the day, okay, or throughout the evening. If you are getting bored or if nothing is entering your head, you stop there. Read something else. So that can actually refresh your brain and it can help in refocusing. It can help in refocusing on your subject. Okay. at some point of time, when its stress is unbearable, you can't manage at all, you are having a burnout, then what you can do is you can take a break. What you can do is you can go for a vacation. Suppose you are in a hostel and every day you are facing stress. You can't manage it at all. It's very difficult for you. It's like it's unbearable. So what you can do is you can always talk to the warden, you can talk to your teachers, and you can take a break and go home for 2 or 3 days and refresh yourself. Or for faculties, if they are having a burnout, what they can do is, if it's too much, you can take a break, take a vacation, go for a week for a trip, and then re-energize yourself. Okay? So deep breathing, as I mentioned, can help in reducing anxiety as well as stress. So stop stressing and start living. So if at all you feel that it is unbearable, you can't do anything about it, there is always help available. We have our mental health professional team in Yenepoya, which includes psychiatrists, psychologists, social workers, counselors. You can always approach us at any time, at any point of time. Okay? We have our helpline number, so which I can give it to your staffs. So you can contact us at any time and come to us. Okay? We have our department of psychiatry. So any problems, any issues, come and contact us. Thank you. Anything, any doubts you can ask? Any questions?
Thank you, sir. It was really a helpful session for the students. Now I request Mr. Sharfan to hand over the token of appreciation for Dr. Shashwat. Students, I request you to kindly maintain silence and listen to the sessions very carefully. Please maintain the decorum. Please don't talk or whisper. Please be attentive. Success is a journey that often begins with the right attitude and is fueled by unwavering motivation. Attitude and motivation are intertwined factors that significantly influence one's ability to achieve their goals and realize their dreams. Our Student Welfare Officer, Mrs. Obaida Shaukat, will help you explore the intricate connection between attitude, motivation and success. I request Ms. Salwa from the MLT department to introduce our speaker, Mrs. Obaida Shaukat.
Good afternoon, everyone. It's an immense pleasure to introduce Mrs. Obaida Shaukat. She's a student welfare officer of Yenepoya Medical College. She's also a neuro-linguistics practitioner, Reiki therapist, hypnotherapist, and a counselor. She has been working with adolescents, teenagers, and adults for the past 30 years. Moreover, she's also a motivational speaker and believes in keeping oneself in a positive state and perfect attitude. I welcome you, ma'am. I extend a warm welcome to you, ma'am.
Good afternoon. Good afternoon. Yes, that's better. I know all of you all are very tired listening. But I think whatever I'm going to say will be worth listening, okay? I'll see that I will not bore you. I prefer this. Okay, I'll be taking you through a journey, and all of you here are old enough in the sense you're all about 16, 17 years or 18 years, okay, in that range. So first of all, I would like you to empty your cup. What do I mean by saying empty your cup? Just whatever is in your mind, don't think that I know more than ma'am or more than anybody. Just empty whatever is in your mind and listen to whatever I have to say. Okay? That is what I mean by saying empty your cup. I'll take you on a life journey. As a baby, the day you were born, how happy your parents were to hold you as an infant in their arms, what aspirations they had for you, and that aspirations are present here in the portals of Yenepoya deemed to be university. You never thought that you would be here. Your parents never thought that as a child that you would be here. But all that hope, how they molded you and how they educated you for the last 12 years and how you are here. You grew up. Infancy is the age of 0 to 5 years probably. So you grew up in infancy. You absorbed everything. What your family said, what your relatives said, what your neighbors said. That's an age where you know, listen to everybody and you are like a sponge. You go on absorbing and everything is in your mind. Whatever you have learned, then you go to school, there the teachers and the children, the different students whom you mingle with them, they have an influence on you and you have an influence on them. So you will start learning new things, okay? School, kindergarten. What was taught to you when you went to KG school? Do you remember your day when you went to the KG, kindergarten? Probably all of you were crying on that first day. You were holding on to your mother's dress and saying, Mama, don't leave me here. Papa, don't leave me here. Take me back home with you. But then, that is also a phase, and that passes away. And then you start learning from day one. And what do they teach you? They teach you, don't they teach you to wish? Don't they teach you to respect? Don't they teach you to interact with each other? Also, what is learned? Here, at this age, when you come here, you tend to forget all these things. To wish, to say thank you, sorry, please. Why do we forget, my dear students? And this is all learned in the formative years, when we are growing up. The first few days of our school days, the starting. They also tell you how not to litter. What is littering? Throwing things here and there, waste. Now I see everybody in the campus, you know, akkas are there to clean, no? So let's litter. You eat a chocolate, you throw the paper away on the streets, on the road, in the classrooms. After you leave your classroom, see how much of littering is there now here. There is also a song which we learn in the KG class. Do you remember that song? Of not littering? Bits of paper lying on the ground. Have you heard it? Yes or no? Yes. So all these things, my dear students, have been taught to us. But we don't forget it. But we tend not to follow it. So, as somebody introduced me, your teacher, why have I come here? I have come here to speak on something which is very, very important, a topic that is very close to my heart, and something that all of us have, and how we can improve on it, how we can work on it, how we can, really, as I said, work and improve on it, but even more than that, how we can change ourselves to that. And that is something, one of the most powerful resources available to the human being. It is the most important word in the Oxford Dictionary. The foundation of success, regardless of your chosen field. What is it? Can anybody tell me what is it? What is that you possess? This is a quality which each one of us have, And without it, we cannot have success in our life. What is it? At least one of you could tell me. That means you're not listening to me. It's very clear. You didn't even listen to the speaker before me. What is it, my dear students? Character. More than that. This is what it is. Your attitude towards life, your attitude towards everything, how you hold yourself, how you portray yourself. What is it that makes you? Your personality. And I say attitude is 100%. How is it? I will prove it to you. Okay? Let's see how ma'am says she can prove it to you. Now if you count, A is the first alphabet of the 26 alphabets. It's 1. T is 20, T is 20, I is 9, T is again 20, U is 21, D is 4, and E is 5. So if you total it up, it's 100%. So what does it say? Your attitude today clearly determines your success tomorrow. It really, really does. And you being in the medical field, in the health field, health department, your attitude really, really matters. You come across patients, you come across doctors, you come across patient parties, you come across your colleagues, you come across your teachers, and it shows how you deal with such people, with these people. If your attitude is not right, my dear students, you will never succeed in anything what you are doing. I'm not saying attitude is ego. Ego is something very different. But attitude is, can you describe, anybody can say what is attitude? Is everything. It's the way you walk, talk, carry yourself, the way you behave, the way you answer, the way you treat others. That's why we say attitude is 100%. I'll tell you a little stories for you to understand more on what attitude is. Do you know who Masons are? Do you know who Masons are? The one who build houses. They put blocks together, stone blocks together, and they put cement and they build houses. And we live in such houses, big or small. Yeah? These are called Masons. Okay. Now 3 Masons were just building one wall. One wall, probably from that end to this end, they were building a wall. And a passerby happened to pass by. One person was passing by, and he asked the first Mason, "What are you doing?" So the first Mason said, I'm just doing this work. Okay? That was his attitude. So he went on to the second Mason and he asked him, "What are you doing?" That man got very angry. He said, "Can't you see what I'm doing? Are you blind? In spite of saying you're asking me, what are you doing? I'm just building this wall, man. He said, okay, relax. So he goes to the third mason. And that mason, like, he hasn't heard what the other two have said. He's so engrossed in keeping the stone, seeing if it is equal, putting the cement on it, and, taking a thread and taking his tape and measuring and putting the right amount of cement. And, he's so engrossed in his work. So he asked the third mason, "Oh man, hello, what are you doing?" First he doesn't hear him. Then he turns around and he sees this man. He asks, "Yes? Yeah, what are you doing?" So the third mason says, "I'm building a monument." What is a monument now? A monument is something which is, which we leave behind, a legacy. There are so many monuments built which in the earlier days, and now we go and visit them, like the Taj Mahal, Red Fort, so many others. So you just imagine what a kind of attitude the third mason had. So you see the different kinds of attitude different people have. He was just building a simple wall, but his attitude towards his work was very, very probably passionate to him, probably high on his mind. Probably he thought, this is what gives me my daily bread. Okay? So that's attitude. The wooden bowl. There was a family living of mother, father, and a child. Okay? A 6-year-old or an 8-year-old child living with his parents, and the child's grandfather was also staying with them. Okay? And they used to all dine together, have their breakfast, lunch, and dinner together. And as the grandfather was getting old, naturally, he's a grandfather, and he was getting old, so, he used to sometimes drop his food on the table, or drop his food down on the ground, or spill the milk, something like that. Not all the time, but sometimes. Okay? So sometimes he used to even break a plate or two. So their son and the small boy's parents got a little disturbed. They used to get angry when he used to do that. But it was not in his, he wasn't doing, the grandfather was not doing it deliberately, or he was not doing it purposely. He was old, he couldn't handle it. So what the mother and father of the child decided to do was, he's breaking a crockery every day, he's spilling all over, so they got him a wooden bowl and a wooden spoon to eat with. So even if it falls down, it doesn't break. Okay? But this boy was very upset. He saw what the parents were doing. And he was really upset. He tried to tell the parents. They said, no, you don't understand. It is, nowadays it's so expensive. I mean, what will a child understand of 8-year-old? What will he understand of expenses? He could only gauge the love of his grandfather and his parents, whatever. So it hurt him a little bit, but he kept quiet. One day, what happened, after a few months, 2-3 months later, the little boy's father, when he was, crossing his room, going past his room, he heard some sound. So he said, what is this little boy doing? Let me go and check in his room. So he had some wooden strips in his hand and wooden something in his hand, and he was, hammering it with a small sort of a hammer and all that. And then the father asked the son, "Son, what are you doing?" So the son replied, he's saying, "I'm trying to make a wooden bowl for you when you grow old, so that, you don't spill or you don't drop when you're staying with me." Yes? So what is it? So look at his attitude now. I'm telling you all this for you to understand exactly what it is. Now the other story is about a donkey's day out. This is very interesting, and the donkey is also very smart. There was a donkey with a farmer, and the donkey was getting a little older. He had served him well. The donkey had served the farmer for a long years, and the farmer said, "The donkey has served me for so many years, it's getting old. Now the donkey is becoming a burden to me, so I might as well get rid of the donkey," the farmer thought. "I can't shoot him because, people will see and it'll die in front of me, and then I have to bury it. It's a long process. I can't do anything else." So he thought and thought and thought. And as he was thinking and going past a village, he saw an old well. And that well was, empty. There was no water in it, and it was empty. So what the farmer did was, he pushed the donkey inside the well. And he said, "The donkey will bray now, so before he brays or before he does anything, I'll cover the well with the mud, so the donkey is buried deep down, and nobody will know about it." Okay, fine. So the farmer got mud, and he started putting the mud inside the well, and he didn't see inside the well. He was going on putting, and he said, "Okay, now the donkey must be down, so let me see what has happened." So when he went and saw inside the well was filled with mud, and the donkey was standing on top. You know what the donkey did? As soon as he put buckets of mud or shovels of mud inside the well, the donkey just brushed it off and, wriggled himself and got free of the mud and stood on top of the mud. Okay? So, that's how the donkey came on top, and then he just walked past the farmer and walked away. Look at the attitude of the donkey here. My dear students, the same attitude can be applied to each one of us when somebody says something to us. We get so offended saying that that person said something, my friend said something to me, I didn't deserve that kind of a statement. He shouldn't have said that, or she shouldn't have said that. But you can just brush it off and say, that's not for me. If you have that kind of an attitude, you will survive in this, big bad world or big good world, whatever. So your attitude determines what it is, what life is, what success is, what everything is. Attitude is the direct correlation of how you think and feel and how you behave and react. First it is direct correlation of how you think here. When you think, you feel it all over your body. Okay? And then how you behave. You behave aggressively, or you behave very calmly, and how you react. Okay? When you think good, your whole body feels good. All the cells in your body will, dance and enjoy and celebrate. But when you feel bad, the whole body, the cells in your body from the top, from the head to the toe, when you feel bad, the same reaction. They'll also feel depressed. All the cells will feel depressed, and how you will react to it in a very negative way. A positive attitude is the foundation of a successful life. So always have a positive attitude towards life. A strong positive attitude will create more miracles than any wonder drug. That is for sure, it's 100%. No wonder drug which no doctor can give you. Rather than that, your positive attitude will have more effect on you than any drug which is available in the market. That is short-lived. Even if you have anything like a drug like that, it will be short-lived. But the strong attitude which you feel within you is for lifetime. Lot of things, issues conspire to pollute your positive attitude. What are those? Discordant family relationships, money troubles, unhappy friends, rude companions, demanding people, even at times, at the time of traffic signal also. Now you all are small, I don't think any of you are driving, but it's a very, very simple and a minute thing. You may even have heard your parents saying, when they stand long for the traffic signal, my goodness, how long this is. I have to leave, I have to go, they curse. It happens, human nature. There also, your attitude shows again. So if you allow the circumstances of life to determine your attitude, think of what you will become. This is a major question for each one of you. Can a student become a good student without a good attitude? That is left for you to decide. Parents spend on you 85% of money and efforts to teach you facts and figures which account for 15% success in life. Don't they? They spend all their hard-earned income for you on your education to get 99%, or, they send you to a good school, then they send you to even better coaching classes. They spend all the money and then they send you to a good institution. By the time all the money of the parents are drained out. But if only they could, reverse this thing and spend 85% on your, attitude and 15% on these facts and figures, each one of us would be, this world would be a much, much better place to live in. At the time of your job opportunities, my dear students, your 85% of facts and figures don't count at all. Only that 15% of how you carry yourself, how you answer them, how you react to the interviewers, that will matter. The first 3 or 5 or 10 seconds, when you just enter the interviewer's room, all the interviewers are sitting there, you go in, the way you walk, how you carry yourself, your body language, the way you sit down on the chair, at that time only the decision is made by the interviewers. They should take you or not take you. They should employ you or not employ you. That 10 seconds is very, very important. How confident you are while walking from the door to the chair which they will ask you to sit on. Will you just pull the chair and sit without them telling you? Or will you wait for them to, ask them to sit? It all matters at that time. Therefore, attitude is everything. The way you talk, walk, behave, carry yourself, and interact. See, now I'm coming to the end of it. I have a formula which I equate thus. It is a vicious circle. What I feel is attitude. If you have the right attitude and if you motivate yourself enough, you are sure to reach success. If you have the right attitude and if you motivate yourself enough, you are sure to reach success. But again, success, you have to again maintain the right kind of attitude at the time of success. Only then, it's round and round and round. It's a circle. Always remember, when you reach success, you cannot say, I have reached success, I don't need anybody, I have everything with me. You can't be egoistic, you can't be proud of yourself. No. Again, the right attitude you should maintain to maintain that success. Keep on motivating yourself at that rate of success also. Only then you will reach again higher success. Okay? So let's see what is motivation. This I told you, have the right attitude, and if you keep motivating yourself, you will have success. Now what is motivation? Motivation is something where there is a motive, one action. Motive means a thought or something, plus action towards it, that is motivation. Okay? Purpose plus effect is motivation. I just can't stand here and say I want to reach there. I have a motive, I want to reach there, the other end. But I can't stand here and say I want to reach there. It doesn't, serve the purpose. I have to act on it. You cannot say that, I want to pass in all subjects. You have to work on it, you have to study, right? Only then it happens. How can you achieve success without putting efforts? You cannot. What are the objectives? We have to be motivated to motivate. Motivation requires a goal. Motivation once established does not last if not repeated. Motivation, if not once established, does not last if not repeated. It's like having a bath every day, like that. You have to motivate yourself every day, in a day so many times, to keep yourself motivated with the right attitude. That is motivation. It requires recognition. Participation has motivating effort. Seeing ourselves progressing motivates us. Group belonging motivates us. When a friend says something good, our teacher says something good, our parents say something good, it motivates us. It comes from our belief system. To move into action, we need to believe in what we do. Unless we believe in what we do, we cannot motivate ourselves. When you come to class every day in the morning, I'm sure you have traveling time, at least 5 to 10 minutes. At that time, you can motivate yourself, saying, today is going to be the best day of my life. Today, I'm going to listen to my teachers very well. Things like that. Okay? So that is motivation. Motivation comes from excitement, and excitement does not come unless there is commitment. What are the motivating factors? Give recognition, give respect, make work interesting, be a good listener, encourage goal setting, provide training, throw a challenge. Demotivating factors comes from money, fame, fear. Internal motivation comes from your belief system, sense of pride, achievement, responsibility. How we are influenced. Here again, there was a small little story where there were two sons to a couple. The sons were very old, old in the sense probably your age, and the couple, the father and mother, were always fighting. Fighting in the sense the father is to come home probably drunk, and he is to demand money, he is to create a ruckus at home, he is to beat the children, beat his wife, and then go off to sleep. So this incident was seen by the two brothers, the two sons, every day, day in and day out. So the two brothers got so affected by this. And what happened? How they related them, going home drinking and then beating up us, my mother, and then, having fights. I just saw that. I didn't see anything else. I didn't learn anything else from my parents. So they asked the other brother, why you like this? So the other brother or the other son said, no, when I used to see this, I used to think, I will never do this what my father is doing to his wife. I will never do that to my wife. See how each one's attitude changed. He had a negative attitude, this one had a positive attitude. So my dear students, it all depends on you. I might stand here and lecture you for hours together. Your teachers might tell you about all this another few hours together. Your parents are telling you every day. But it all depends on each one of you. How you going to, travel through your lifespan? How are you going to react to all this? How are you going to, focus on life, and how are you going to, take up life forward? Okay? We come to the last portion, that is success. And definitely, I cannot spell success without you. There's a success, yes. There's a you in the success, yes. I agree with that. But at the same time, if each one of you were not here, I wouldn't have had that kind of a success. Because you are here, so many of you, I have success in my life. Think about it. Why am I telling you this? I will not elaborate on that. What is success? Different things to different people. What is success to me may not be success to you, my dear students. For you, success at that moment may be to pass your graduation, to come out with flying colors, or to win some quiz competition. Maybe that will be a success. I don't know. Each one of us have different success. So it may be home, vacations, financial security, leadership, freedom from worries and fear and failure, self-respect, doing well in exams. Therefore, you can win success by believing you can succeed. Believe in yourself, believe you can succeed. And good things do start happening. Your mind is a thought factory, producing countless thoughts in a day. Would you believe how many thoughts cross your mind every day? I know none of you are listening, so I cannot question you also. But if I have at least one or two person listening to me, that would make my day. It would make my career here in Yenepoya. That's it. I wouldn't expect all of you to listen. So I just had this one question. You should know this. How many thoughts cross your mind every day? Would you believe at least minimum 50,000 thoughts cross our day every day? We think 50,000 times, different thoughts. Our mind is such a powerful thing which, cannot be controlled very easily. So, a mind is a thought factory. Winners don't do different things. That's what Shiv Khera said. They do things differently. Success is 1% inspiration and 99% perspiration. That inspiration is, I want to do well in life. I want to get first class. I want to top the paper. I want to top the exams. That is the 1% inspiration. But you have to put in that 99% of perspiration. That is effort. Only then success will happen. But for some of you, it may not be that. You all may be good enough or excellent enough. Success is the progressive realization of a worthy goal. Progressive means it's a journey system. Realization is experience. Worthy goal is value system. Success and happiness go hand in hand. Success is getting what you want, and happiness is wanting what you get. See the difference now. So, my dear student, just don't exist. Live your life. We are all existing here, mind you. I don't want you all to exist in this world. I want you all to live your life, enjoy your life, be worthy of your life. When you think back after maybe 30, 40 years, you must think that, my life was really worthy and I've lived it well. You have to give that credit to yourself, which I often give to myself. Okay? You have to not just touch, you have to feel. Touching is like we touch everything every day. We have to feel it. Not just look, we have to observe. Only by observing we will know what is happening in this world. Read. I don't know why that came. Hear, listen. We hear. Everything we hear, I hear the sound of the AC, I hear the sound of the rain outside, yes. But I have to listen to what you have to say. I don't want to miss something important what you have said, so I have to listen to you. Okay? And listen carefully to understand. You have to understand somebody. Relationships are very important. If you feel relationships are important, you have to understand that person. Thomas Edison, you know who is? Who invented the bulb, failed so many times. Colonel Sanders, he was the famous person for KFC, Kentucky Fried Chicken. He also failed almost 1,000 times. He used to go door to door to give his recipe or sell his chicken, but nobody wanted it. At the age of 65 with $10 in his pocket, after he retired. So if at the age of 65 could succeed in his life, why can't you and me? Okay, with this last few words, I'm going to end today. But this is very important. Socrates is a very wise man. He's a philosopher. I don't know if any of you have heard of him. I don't think so. If any of you have heard of him, is very great. He's a motivational speaker. He was a philosopher. He was a very wise man. Okay? Now, he was approached by a young man who was fed up in life. And he said, "Sir, I want to be successful in life." What? What did he want to be? Successful in life. So Socrates said, "Yes, my boy, I will teach you how to do it. Come to the riverside tomorrow and I will tell you how to be successful." So the next day, early morning, this man was by the riverside when Socrates was already there. And then Socrates led him towards the river, walked him towards inside the river. And then they were in the middle of the river. Socrates took his head in his hand and put his head down in the water. Okay? When he put his head down in the water, for 1 or 2 seconds he was okay, but then he started gasping for breath, naturally. When he was really gasping and he couldn't even, breathe, Socrates took him out of the water. And he told him this one sentence. And I'm telling you also this only one sentence, my dear students. When you feel you need success as much as you wanted air underwater, when you feel you need success as much as you wanted air underwater, then you will have success and you will be successful. Okay? With these few words, I end. Thank you so much and all the best. And I welcome all of you once again to Yenepoya deemed to be University. Thank you.
Thank you, ma'am. That was really an inspirational talk. Hope our students go home with a positive attitude, highly motivated, and climb the ladder of success. Now I request Mr. Uwais to hand over the token of appreciation to Mrs. Obaida Shaukat. Thank you, ma'am. Thank you, sir. Apart from the regular curriculum, self-learning courses, often referred to as online courses, provide individuals with flexibility to acquire new knowledge and skills at their own pace and convenience. These courses cover a wide range of subjects and can be a valuable resource for personal and professional development. Mr. Subramani will brief us about the various SWAYAM courses available in the university. I request Ms. Rashmita to give a short introduction about Mr. Subramani.
Good afternoon, students. I here take the privilege to introduce our next speaker, Mr. Subramani K., who is an assistant professor in the Department of Commerce and Management at Yenepoya Degree College. He has pursued his bachelor's in commerce from SDM College, Ujire, with a specialization in the cost and taxation. He holds a master's degree in commerce with specialization in finance from St. Agnes College, Bangalore. He has done several paper presentations at national and international conferences and has a work experience as guest lecturer and assistant professor in St. Agnes College and MAPS College, Bangalore. I hereby welcome you, sir, on the stage.
Good afternoon. Good afternoon. Okay. So after several sessions, you all are tired. And I thank Obaida ma'am for motivating the student before my session. My name is Subramani, Assistant Professor, Department of Commerce with 7 years of experience in teaching. So all of you are in, all of you know about AI, artificial intelligence. Am I audible? Artificial intelligence, ChatGPT, everybody is nowadays, even in WhatsApp also you can use ChatGPT. With ChatGPT you can text in a different way. So why I am talking about Swayam? Yeah, first session when I came, it was all about diet plan. After that, stress, oversleeping. Bear me for 10 minutes or maybe for 5 minutes. I will not take more than that. And I'll tell you my experience about the self-learning, why you have to go for self-learning. I'm basically Tamilian. I was not able to speak in English. You won't believe. Even Malayalis and Tamilians and any other language for that matter, we never speak in any other language. When we come to Mangalore or somewhere else, even in Yenepoya I see, the student will come and they speak to somebody from Karnataka and they teach Malayalam to this guy and they will never learn Kannada. And they will never learn English also at the end. In the same way, even I came to St. Agnes, 9 years back to Mangalore, and even I thought I came to Agnes only because of learning English, how to speak, because I couldn't even introduce myself. I couldn't even introduce myself on my first day because all were girls, only 3 boys in the class. 60 girls, 3 boys. Amar, Akbar, Anthony. One Muslim guy, one Hindu guy, and one Christian guy. Okay, we 3 were there, and in the long run, and usually these girls have that attitude that they will never speak in other language even if they know. They speak in English only. In the same way, on the first day I went to introduce myself, I couldn't introduce. Later, literally I cried. Then evening only I decided that when I leave this college, I have to become a professor, how to become a lecturer, how to communicate so well. Then I went to YouTube. You might be knowing about the TED Talk. Have you ever watched TED Talk? Usually I watch, now also I watch, maybe 20 to 30 minutes video every day I watch, where you can learn by yourself. Nobody is needed. The name itself says Swayam. Swayam is nothing but self. Swayam is nothing but self, where you can learn by yourself. It is a central government course introduced by MHRD, Ministry of Human Resource Development. Each and everybody, you must have come up with your own aspirations. You must have taken some other course, maybe BBA, BCom, or might be allied science, anything for that matter. But if you want to learn about any other topic, maybe any of you know about trading? Anybody? Anybody knows about stock market? Okay, so these kind of things, that if you know about the trading, usually Malayali guys does this, trading, because once you know it, the tactics or the strategies very well, you can make money like anything. Maybe within one day, 10,000, at the same time you may lose lakhs together, rupees also. Okay, but these things, if you want to learn, maybe about the photography, or might be about the artificial intelligence, or might be about aeronautic engineering, but you have taken BBA and BCom or allied science, nobody will offer this course somewhere else. This Swayam is having more than 600 to 1,000 courses free of cost. We are not aware of the knowledge, aware of the worth of Swayam only because it is free of cost. If anything is given to Indians with free of cost, we will not utilize it up to the 100%. Okay, so as I said, I will not drag it for long. So Swayam is a central government course which is introduced in the year 2017 by Pranav Mukherjee, which has all the areas, maybe the agriculture, humanities, finance, banking, every area, medical, all the areas are covered by highly professional, highly specialized faculty members by the UGC. Okay, and at the same time, UGC made it mandatory for all the students, UG students, you have to take up this course and your credit, that is called as credit transfer system. You can skip one syllabus or maybe one subject according to, you have to talk to your curriculum committee or maybe your faculties or anybody for that matter. You can talk to them, and if it is that provision is given in the syllabus, you can skip the one subject and you can do it in the Swayam course whenever it is available, and the credit will be transferred to your ABC ID, Academic Bank of Credit. If it is not done, please do it today itself, Academic Bank of Credit. Very important, not only now, even DigiLocker, please maintain your DigiLocker. Nowadays, we are the facilitators. Faculty members are just facilitators. Everybody knows more than the faculties. Even student knows more than the faculty members. I always believe that because you have everything in your mobile phone. You have everything in your mobile phone. We are just a facilitator. So on this way, I have learned so many things because of Swayam. So Swayam, you have to take up the course. It is simple. Go to Google, type Swayam Central. I'll show you the page later. Swayam Central. Once you click Swayam Central, it will ask for the login. Login with your official ID. Official mail ID, maybe Edu ID you will be having. If not, please create. Once you create Edu ID, then you can log in. And you have to go to the courses. All the courses will be available. And you talk to your class teacher, or maybe once in a while I will visit your campus. Whenever, if it is needed, I'll visit your campus and I'll tell you which course you have to adopt. And I'll talk to your vice principal also regularly. And if it is needed, I will tell you which course you have to take up. Yeah, that we can sort it out. And if you take up the course, for knowledge purpose, there is no money. You can watch n number of videos, maybe more than 1,000 courses. It is available in the Swayam, maybe 10,000 around. They have the target. You can watch n number of videos regularly. You can update your knowledge. But if you want to write the exam, you have to pay 1,000 rupees. And you have to write the exam and you will get the certificate. Why I'm talking about the skills? See, if I am the recruiter or the owner of any company, if I need 1 or 2 employees from this particular group, I will not take everybody, or else who have got 90% mark. Who have got 90% mark will not be taken into consideration at all. What I will do, I will choose one guy with 60% with plenty of knowledge about the SAP, Peachtree, or maybe in different AI, and different softwares, Chat GPT, or whatever it may be for that matter. Marks are just numbers. Marks are just numbers. The reason is, my friend, today morning I texted my friend. He was not even regular to the class. Okay. But he had good knowledge, he had good communication, and he was doing some courses along with studies. Today he is earning 3 lakh rupees per month. 3 lakh per month at my age. At my age is earning 3 lakh rupees per month. Where we are. What mistake I made? It is only because the skill set, SAP softwares, or different operating systems. These things are available, but we are not using it. We are not using it. And one more thing I want to tell you, you have the assessment that every week every week, once you take up the course, every week you have to go for assessment. Assessment in the sense assignment will be given, 15 MCQs, simple MCQs will be given. If you watch the videos, you will get to know how it works. Once you answer all the exam, then you will be having a offline exam. If you register, the center, everything will be given. You have to go and you have to apply for, you have to perform the exam and come back. And the 50%, 40 to 50% will be the passing mark. And there are n number of faculties also have applied for the exams and they were not getting it. The reason is there are specific limitations. The limited seats will be available. Even if you apply also, you will not get the exam. Sometimes. Okay. All will not get the chance. So Swayam is mandatory course which is introduced by the central government MHRD. So once you go home or else whenever you come back to the college, you talk to your teacher. The day one only you talk to your teacher, class advisor or subject teacher, anybody for that matter, talk to them and opt for the course. I don't know whether, now it is not available as of now. So there are specific courses, I will send it to the vice principal and they will send it to the class teachers. There are specific courses which is available right now. And maybe in the month of Jan or maybe in the month of December, again next lot will start with 1000 courses or 600 courses so that you can adopt the course and you can continuously, you can complete the course and you can get certified. And it will be used. For example, you have done the research. You have done one course on research and development. Research and development, whenever you go for corporate, you will be recognized differently. You will be recognized differently. And one more thing I want to tell you, one more milestone of Yenepoya, that is Coursera. We have taken the, Coursera. More than 3,500 students can apply and more than 300 faculties can get free course. If not, you have to pay more than 5,000 or 6,000 rupees or 2,000, 3,000 rupees per course. So please go to the Coursera also. Even if you have time, please watch Coursera videos. It is highly qualified international speakers. If you want to learn about financial markets, or else anything for that matter. Even MBA also you can do it in Coursera, but it is too costly, you have to pay 20 lakh rupees. That is different. So if you have any questions, you can ask me. Anybody is having any questions? Second row, boys. Enija? Second row, boys. Any doubt? So this is the Swayam login page, first page of Swayam, and so you have to go to the sign in or register, then it will take you to the Gmail or maybe, directly it will take you to your mail ID. You can go with Edu ID and ABC ID. Please create your ABC, Academic Bank of Credit. Anytime we can go with, you can accumulate the mass card. So DigiLocker, all of you, please upload your mass cards and all the documents in DigiLocker. So whenever it is needed, you can directly access to the DigiLocker and even ABC ID will be there and your all the mass card will be accumulated in this particular ABC ID. If you put the number, you will get all the documents. So please aware of ABCID. If you are not aware of it, go to the DigiLocker. Just type DigiLocker in Google, then you will get, once you access into the DigiLocker, you have to put the password, user ID, everything you have to put. Later on, ABCID. If you go to DigiLocker, if you type ABCID, it will ask you to create ABCID. You can directly create, and the number you always remember. The rest, everything will be done by the system only. So how to register? I said go to the click register as a student. If you are a student, you can click as a student. The PPT I will send it to you. Yeah, I will send it to your vice principal so that you can watch later. You can see it later, and then fill the details to enrollment. Click on sign up. Click on sign up. The main intention from the above point, it is ICT playing major role in the education for enhancing learning. In the present context, learner will be able to get quality teaching from the top institution expert. See, if we cannot get the faculties of IIT or IIM, but if you go to Swayam, you can watch n number of videos which have been done by the IIT faculties and IIM faculties. Okay, and all the best for choosing Yenepoya. And if you have any queries, you can mail me. I will send the mail ID also later. You can mail me regarding this Swayam. If any queries, I will respond to it, respond to each and every individual mails. Thank you.
Thank you, sir. That was really informative. Now I request Mr. Abdullah to hand over the token of appreciation to Mr. Subramani. Apart from the academics, young people have to engage in various humanitarian activities, community services, disaster relief efforts, etc. The Youth Red Cross is a youth-focused humanitarian organization that operates as a part of the International Red Cross and the Red Crescent Movement. Ms. Nityashree, the nodal officer of the Youth Red Cross, Yenepoya University, will give us a gist of the YRC in the university. Ma'am, we welcome you to this dais.
Good afternoon, students. I request all the students to settle back. After this session, will be given the lunch break. The session will be around 10 minutes. After this, the lunch break will be given.
A very good afternoon to each one of you. Good afternoon. Are you hungry? Okay, I'll take around 10 to 15 minutes. I'll leave you fast. Okay? Will not give a boring session to you. I request everyone to stand up. So here I have with me Ms. Sai Shri from Yenepoya Physiotherapy College, Program Officer, Youth Red Cross. So we will teach you how to do the welcome clap of Youth Red Cross at the beginning. Okay? So you have to welcome me, and I am welcoming you to Yenepoya University through this welcome clap. Okay? Are you ready? Are you ready? Yes. So there is here, like when I say Youth Red Cross welcome clap begins, what you have to do is you have to say the statement, we help, service, friendship, welcome, 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 and you have to do knitting and clapping in between. Okay? I'll teach you the clap how you have to do. Okay? In school days and all, you might have done 1, 2, 3, 1, 2, 3, 1, 2, 3. Not the same way, but little changes. Okay? Let us start. Yes? Okay. Youth Red Cross welcome clap begins. So you have to do, we help, service, friendship, we help, service, friendship, welcome, welcome, welcome. So this is the Youth Red Cross welcome clap. I request you to repeat with me. You have to do knitting first, then you have to clap twice, and you have to say, we help, service, friendship, and we help, service, friendship, welcome, welcome, welcome. This is the welcome clap of Youth Red Cross. Are you ready? Yes. Let us do it together first, then you can do it alone. Okay? There is welcome clap as well as the thank you clap. When welcome clap we say, we do it as this way. When thank you clap you say, you keep your hands downwards. Are you clear with this? Okay. So Youth Red Cross welcome clap begins. We help, service, friendship. We help, service, friendship. Welcome, welcome, welcome. Are you clear with this? No? Yeah. So I'll take Sai Shri ma'am as a leader for this group now, and madam will command the Youth Red Cross welcome clap begins. You have to do the welcome clap now. Are you ready?
Youth Red Cross welcome clap begins.
Are you clear with this? Okay, you can do it now. Youth Red Cross welcome clap begins. Thank you so much for this effort, and thank you. Thank you, Sai Shri ma'am. So, just a brief introduction about the Red Cross Society. So, this International Red Cross Society is a voluntary organization where you are the ambassadors of the Red Cross Society. I said you because you are the Youth Red Cross volunteers. So, you become the ambassadors for Indian Red Cross Society from Yenepoya deemed to be university. So, mainly, the government of Karnataka has visualized the need for grooming up of all the youth for the preparation for voluntary to do the humanitarian services for the public or the society. So here, each college, like wherever, in all the parts of the country, we have like Red Cross societies in districts, state, as well as all over India. And here, the Youth Red Cross unit are constituted in each colleges, which is affiliated to the Indian Red Cross Society of State Branch. And the youth of that particular college become the ambassadors for the Youth Red Cross, and you are the future of tomorrow. Hence, grooming you or building you for the development of the future, we need to have such type of the units. Last day, you might have heard about National Service Scheme and other units which is functioning in the university. In the same way, we also function under the banner of Youth Red Cross, Yenepoya deemed to be university. Each college has the program officers for this particular unit. And from here, as I said, physiotherapy college I shown you Miss Sai Shri, and from Allied Sciences you have Miss Akshita, as well as along with them you have Akshay and yes, please stand up, whoever is the faculty in charges of Youth Red Cross, so that your students can see you. You can see Akshay sir over there who is walking, and the faculty here, you can see them. Okay, fine. Do you know this person? Anyone know this person? Anybody were the part of Junior Red Cross in your college days or the school days? Just raise the hand. Yes, I can see the few hands which is raised. So can you name this person? Who is this? He is the first person to receive the Nobel Award for Peace. He is John Henry Dunant, who is the founder of this Red Cross Society. He has received the first Nobel Prize for the peace activities. Like, why this Red Cross Society has started? So, in the year 1859 around, there was a battle which happened in the area of Solferino. So, this Jean Henry Dunant was not any medical professional. He was a businessman. He was from Switzerland. He was walking for the, that means he was traveling for the permission to start a flour mill in his place. And when he was traveling through the Solferino, what he found was there was a battle which was happening between Italy and France. And so here he thought he forgot completely for what he was traveling. And he stopped his journey to getting the permission. He stopped by seeing the suffering of the people. There were more than 3 lakhs people who were suffered, and they were undergone injuries. Soldiers, many were there. So he thought he has to serve the people, and he forgot his business trip, what he was doing, and he started to care the people. So after few days, everyone started to forget the incident, but still this person was not able to forget the bitter memory of the things what has happened in the war, and the suffering of the people. So what he has done is he came back to his place and he started to write a book, that is Memory of Solferino, which is written by Jean Henry Dunant, and he started to spread the news of this particular bitter truth of the war to all over the leaders of the world. And he wanted to start a organization to maintain or to treat the patients or to give the care for the patients, neutral organization. So with that, he has started, see, this is the Battle of Solferino, what it was, and here he started the organization International Committee for Relief to the Wounded. And to start this, they need to have one committee. He's constituted with this committee with 5 members, and he started this was the committee members. Henry Dunant was the secretary for the committee. And there were 4 conventions which was taken in the Geneva, where first convention which said any soldiers who are wounded, they will not be they will be neutrally cared by anyone in the area. Second was on the armed forces in the sea, that is Navy officers, whoever affected during the war, they will be treated irrespective of their place or the from whichever the country they belongs to. And third one was for the prisoners, whoever the prisoners, soldier prisoners, they will be cared neutrally. Fourth one was related to the relative or the persons who is related to this injured persons, and the civilian public will treat it neutrally. So these are the 4 conventions which was taken. And the objective, so you can see here the emblem of the Red Cross Society. So Switzerland flag, where the background is the red and plus is the signature sign, where it is in white color. So the reverse of this Switzerland flag, that is white background with red color, cross, that is the, and whichever the country doesn't want to put cross as their banner or the emblem, they can choose the crescent as their symbol. And this mainly this symbol is used for the purpose of protective and indicative. Whenever we see this symbol or the emblem, it is meant like it is a neutral organization which is helping the society or the nation. And next is, you are not supposed to use this emblem anywhere. Might be in the car or might be in your general store, like ambulance, or in the, like as a doctor to symbolize, we are not supposed to show, or in the pharmacy or in the hospital. We are not supposed to this cross as your symbol or the emblem to your vehicle or anywhere. So, like it has been given, use this ambulance or the doctor, pharmacy, hospitals, reputed whatever the emblem is given, the same thing has to be used. And next is, this was earlier which was used as an emblem. And as I said, Jean Henry Dunant received the first Nobel Prize. The only organization which has got 4 Nobel Prizes for the peace activity is only Red Cross Society. And the founder died in the year 30th October 1910 at Hayden, and the birth date of this Jean Henry Dunant, May 8th, is considered as the World Red Cross Day. The activities are conducted on this particular day for the youth based on whichever the area the colleges can be performed, they will be organizing some or the other activities. So the principles of this Red Cross is, one is humanity, impartiality, neutrality, unity, voluntary service, independent, and universality. So humanity, humanitarian service, impartiality. The Red Cross will not see of, like when you are providing the humanitarian services, impartially providing the services to the public. And neutrality, the Red Cross volunteers are neutral, they are not bound to any political or the regional, religional activities. And unity, unity in the sense like it is not only in Mangalore or Karnataka, all over the world it is constituted, and they follow the same principles in all the places. And next is voluntary services. It is not I am forcing you come and here to my class here, or you come and join for the voluntary service. It is up to you who can take the decision and join for the Red Cross wing and join as a volunteer. And independent, you are independent to take the actions. And universality, it is all over the world, it is the same. The core activities, what we do here, one is related to the health, hygiene, care in the community. We do these activities. And next is first aid. And next one is a disaster response and rehabilitation, disaster preparedness, blood donation. So these are the other core activities. And source of the fund, we receive it from the Red Cross Society for the Indian Red Cross Society, not for the Youth Red Cross, but for the activities, they give the funds released if we request. And in India, Indian Red Cross Society has originated in the year 1921, and in India we have completed 100 years for 2021. So organization, it is at the national level, state level, district level, and the taluk level we have. So Indian President is the President for Indian Red Cross Society at the national level. And the organization, it is spread all over the states and the union territories. So organization setup of the Youth Red Cross at the state level, and state branch we have the YRC nodal officer. Like each universities will have one nodal officer. Under the nodal officer, whichever the college is affiliated to the Indian Red Cross Society, they will have the program officers based on the unit. And college YRC subcommittee, program officer at college level, student management subcommittee. So this is Indian Red Cross Society Dakshina Kannada branch. We have the chairman, secretary, as well as vice chairman and the treasurer and other committee member. There are various committees which is related to the first aid, which is related to the disaster, and we have a public relation, junior Red Cross, blood donation, women and child welfare. These are the other committees. So now about Youth Red Cross, how I can be the Youth Red Cross member. So one college can get the affiliation to Youth Red Cross once you register at single time. So that the first time, now our all 10 colleges, we are affiliated to the Indian Red Cross Society by paying 1,500. Like within last year, we have completed of all colleges registration affiliation. And each college student, like now you are as a student, you have already paid your 50 rupees in your fees amount to the Youth Red Cross Fund of University. So from that 50 rupees, 35 rupees we are keeping it for the programs to organize, and 15 rupees will be sent to the Indian Red Cross Society. Out of that 15 rupees, 5 rupees again we will get it back to the university to organize the program. So you have the right to ask in the future days, what has happened to the money if the activities are not conducted, or like if you are not getting any benefit, you have the right to ask it. So you, as a Youth Red Cross wing persons, you have the right to ask for any of the programs. If you want to organize, you can ask to your program officer and we can organize the program, and it is all for your development which we are organizing. Okay, each college has a program officer, university has a nodal officer, and these are the activities. As I have said, the core activities, health and hygiene, first aid, blood donation, disaster preparedness, and many more activities which we can conduct. That all in the, as a voluntary humanitarian service. So in each college, principal is a chairperson, and faculty program officer is a secretary of the committee, and one faculty member, student vice chairman, student secretary, one representative from district or taluk branch. So being a program officer, your program officer is very proud to say that she or he is the program officer of your unit, because they have the right to mold the youths for the betterment of the future or the society. So these are the activities which we have already discussed, and few more. These are the few activities which we have conducted. Like we have the internship program at District Venlock Hospital, where our students are going and serving the government hospital patients or the clients, where they serve them with the library services or emergency services, etc. Also, recently one patient from Padil, he was donated with the artificial limb from the degree college students of Yenepoya, and district commissioner has come and he has done this program on behalf of us. And this is the internship program which we are organizing, and these all. So this is the last year World Red Cross Day. So these are the few glimpses, and many more. You also can be a part. You can think of the many more activities. You can be the part of the new things which we can do it. Will you be a part of the Youth Red Cross wing? Yes or no? Yes, thank you for it. So let us do the thank you clap. No, not this. Kindly stand. Yes. Okay. You remember the clap? Shall we start? Youth Red Cross thank you clap begins. We help, service, friendship. We help, service, friendship. Thank you, thank you, thank you. Okay. Thank you so much. Thank you for the opportunity.
Thank you, ma'am. I hope many of them will participate in the Youth Red Cross activities. Now I request Mr. Prajwal to hand over the token of appreciation to Nitishri, ma'am. Thank you, ma'am. Thank you, sir. Now, students, we will break for lunch. Now it is 1:30. Sharp at 2:15, come back to your places. Be in a line. And then you can go and have your food at the respective counters.
I request all the coordinators, please make sure all your students are assembled inside the auditorium. I request all the coordinator, please make sure all your students are assembled inside the auditorium. We are out of time. I request again for all SWOs and all the coordinators, please make sure. And the students who are standing outside, please gather inside the auditorium. We are going to start the session. I request all the students who are gathering outside, who are standing outside the auditorium, please enter inside the auditorium. We are going for the last session of day. The last session of today. Orientation to sports facilities by Mr. Sujit KV, Physical Director of Yenepoya, deemed to be University. The session will begin shortly. I request all the students, please assemble. The next session will be on orientation to the sports facilities.
Students, kindly note, we are going to begin our afternoon session. Now this is one important and interesting session which you may be eager to know. Apart from academics, you are coming here also for, you might be looking into many other activities also which you want to have in this university. So in that, one of them is the sports. So sports play a significant role in college life, offering students numerous physical, mental and social benefits. So college sports programs are diverse, ranging from the university to intercollegiate sports to intramural and club sports. So Mr. Sujit KV, the physical director of Yenepoya deemed to be university, will give us a glimpse of the various sports facilities available in the university. I request Mr. Manish to introduce our speaker, Mr. Sujit.
Thank you, ma'am. Dear students, it is with great pleasure that I introduce you to Mr. Sujit KV, a distinguished figure in the world of physical education and sports. With a career spanning several years and a passion for nurturing sporting talent, Mr. Sujit has made a significant contribution to the field. Mr. Sujit holds the prestigious position of Physical Education Director and serves as the head of Department of Physical Education at Yenepoya deemed to be university. He commenced his journey at Yenepoya on the 8th of February 2016, where he has been a driving force behind the university's commitment to physical fitness and sports excellence. His academic achievements include an MPhil in Physical Education and Sports Science from Annamalai University in 2008, and a Master of Physical Education specializing in football from Mangalore University, which he began from 2002 and completed on 2004. His academic journey began with a Bachelor's in Arts in History from Government College, Kasaragod, Kannur University, which he completed in 2002. Sujit's work experience is marked by dedication and excellence prior to joining to Yenepoya, where he served as the Assistant Physical Education Director at Jain University, Bangalore, for a remarkable 8 years, from July 2005 to March 2013. His commitment to physical education extended further as he worked with FitKids, a renowned American-based physical education company, at institutions such as Amrita Vidyalayam in Mangalore and Rajagiri School in Kochi from November 2013 to February 2016. Additionally, he served as the Resident Physical Director at Mysore Public School from August 2004 to March 2005. Sujit's professional sports achievements are a testament to his coaching prowess and dedication to sports development. He coached the Jain University team to victory in the All India Inter-University Swimming Championship for 2 consecutive years in 2011-2012. As the manager of the Jain University team, he also led them to success in the South Zone and All India Inter-University Cricket Championship in 2012-13. His expertise extended to various sports as he traveled with Jain University teams for inter-university competitions in athletics, badminton, shooting, and basketball. Furthermore, Mr. Sujit's coaching acumen shown as he coached the Bangalore University boxing team for the All India Inter-University Championship in 2006-07 Rohtak, Haryana, and 2007-08 Solan, Himachal Pradesh. His contributions to badminton coaching were equally noteworthy, as he coached the runners-up Bangalore University badminton team in the All India Inter-University Championship 2007-08, held in Cochin, Kerala. Ladies and gentlemen, please join me in extending a warm welcome to Mr. Sujit KV, a distinguished educator, coach, and sports enthusiast who continues to inspire and shape the future of sports of physical education in our university.
Thank you, sir. Good afternoon, everyone. Good afternoon. No energy. After lunch also you don't have energy. Hope everyone had your lunch, right? Good afternoon. That much. Okay, I'm Sujit, and Physical Director, Yenepoya Deemed to be University. Before the introduction, I want to play a small presentation of our one tournament which we are hosted in the same auditorium. It was All India Inter-University Best Physics competition. And it was a national level competition which we are conducted. It is a pride to be conducting one AU Association of Indian University, All India Inter-University at Yenepoya Deemed to be University. You will be listening lecturers and classes here, and the patients, I don't want to test you. And I want whoever are sitting here, please give attention here. Whoever are sitting here, okay, this is the chart of what Yenepoya University Department of Physical Education, how it goes. Like other department or other colleges, the Vice Chancellor under that registrar and physical director comes, and we have a sports committee. We have 11 colleges under Yenepoya deemed to be university, and all the 11 colleges we have a sports coordinator, and they will be monitoring and helping out you, helping to get you here, because now the Yenepoya deemed to be university also we have various courses now. That's why we will not be able to come directly to you, or you can anytime come and report here. But who are good in sports, you can approach your sports coordinator. They will guide you how to go about it. And we have a basketball coach, football coach, kabaddi coach, and volleyball, and we have a gymnasium coach. This is about my department staff. I'm heading the department, and Mr. Prabhakar is the assistant director, and Mr. B.B. Thomas, football coach. Now he is in with the under 19 Indian team as an assistant football team coach. And Mr. Shashi Kumar Nair, he is a basketball coach. And Jagdish Kumbla is a kabaddi coach. He is a pro kabaddi coach also. And Ashfaq, Ramakrishna, Mohan, and Asif, all these people are our gym trainers and supporting staff. Tejaswini, Sabina, Akshita, Vidya Chandra Lovely, Charan Raj, Ashraf, Narayan Praveen, Ashish Pandey, Razik, and Abdul Nazir. This is my team. And you will be thinking, what is role of the department for your college? So the Yenepoya deemed to be university, we support a lot of things for the sports, and we conduct a lot of sports activities. We conduct 20 disciplines in sports activities. That is, we will have an intramural competition first. That will be within the college. We will have an intramural competition, and the winners we will give one more opportunity to play in inter-collegiate for the constituent colleges of Yenepoya deemed to be university. We will do the inter-collegiate activities also. So this is where you are sitting. This is our infrastructure, what we have. We have a multi-complex sports facility. This is a multiple use. Here we have a basketball court, throwball court, volleyball court, badminton court, and gymnasium and table tennis. And we have a small theater also here. This is our gym, and we have a international standard soccer ground you would have seen while coming here. And this is the tournament we conduct for our Yenepoya University students. We have an intercollegiate Premier League cricket tournament, and football tournament, kabaddi, women's cricket, intercollegiate tug of war, chess, carom, table tennis, badminton, basketball, volleyball, throwball, and football women also we started. before shifting to the other slide, I just wanted to check how any of you are played state at the nationals. I think everybody are sleeping. Can you please get up once? Everyone, can you please get up? Stand up. And please keep your cell phone in your pocket. I've seen many people are using cell phone. Okay, sit down. Normally, when I come for the introduction for this program, everybody cooperate well because everybody wanted to play some or other event, and sports is one event where you people get relaxed during your academics time, and it is totally different from your school level sports and university level. Now you finished your 11th and 12th schooling and 11th, 12th, so you would have had a PE period in colleges and all. There is no PE period for you, but you will have enough time to do practice in sports event after the classes, and this endurance is open for you in the evening. For the girls will be separate session and boys will be separate session. Even the gym also the same. We will not permit any girls and boys will be practicing together in any of the playground here. Only during the competition we conducted together. In the sense, it will be different competition, but it will be in the same time. And now I wanted to know, any student in this group have represented at any state, Kerala, Karnataka, Tamil Nadu, or Maharashtra, from wherever it is, at the nationals? If anybody is there, please, can you please get up, stand up.
Myself, Amina Fatima from BPT. I am a BPT student. Ayo. Yeah, I went for Kabaddi Nationals and Athletics.
Congratulations. So, Kabaddi, for the men, we have very good team. We have 4 pro Kabaddi players in our team, and rest all national level players, and our team trained by Mr. Jagadish Kumble. He was the pro Kabaddi coach and an Indian team coach and all. Okay, so I would love to have one Kabaddi women's team also. So let's see, if I get 12 people, definitely I will make one team here. And anybody, any other girls have played Kabaddi here, please stand up. Don't bother whether you have played nationals or anything. Any girls? Kabaddi player? We have an intramural Kabaddi competition for girls also. So your team will be very strong. You have a national player here. And please come and give all the details to my department. That is my department. Okay. Thank you. Any other sports? Okay, state level. State level in the sense you would have represented district at the state level. That will be many number, I hope. Anyone? One, good. Two, three, 4, 5, 6, 7, 8, 9, 10. Okay, good. So, in this, how many footballers? Please raise your hand. No footballers? Your football. And tell me which game you played. Which game you played? Okay. Martial arts. Okay. You please get all your details and come and give to me. Okay. We will make a team. Not an issue. It's a All India Inter-University Direct event it is. Okay. You please get all the document and submit to me. Judo. Yeah, we had a judo team. You are represented state? Yeah. Represented district at the state. What was the position? 4th. No problem. Kabaddi. You're from? Thrissur. Kabaddi, let's see. Okay, I will. State, Kerala state. Okay, which state, district? Boxing. Good. I was also a boxer. I won Kannur University 4-time championship, and up to 2002 I would represented. After that, my post-graduation and the job I could not do. And what is your name? Sinan. No problem. Get me all your certificate and come and meet me there. Okay. Tug of war. Okay. Chess. Good. Badminton. Badminton, which level have you played? State. You represented district at the state. Okay. And you? Kabaddi. Meet me after that. Okay. Handball. Good. Anyone this side? No. Tell me, which game? Basketball. We have basketball coach here, Mr. Shashikumar Nair. Okay, you can give all your credential here. We will, once your restriction period over, we will start training you. Basketball. Good. Kabaddi. Athletics. Which event? Athletic event. What is your timing? You don't know the timing. Handball, table tennis. Discus throw. Football. Got good physique. Okay. Come and meet me. Give me all your documents. And which game? Wrestling. Give all your documents. All the certificate. Okay. Let's see, we will prepare team. Thank you. So, Many are there, here it's sitting, they don't want to stand up and tell. No problem. Anytime you can come to the department. If I am not there, somebody will assist you. Okay, you please, when you are coming, get all the xerox of your certificates and please put it in a paper, what all the achievements you had. We definitely support you. And only thing, you have to manage both academics and studies. Wherever you go for the event, I can get the attendance, but not for other time. Okay, so we have a sports quota system here. So we have a sports quota in football, kabaddi, and we have a best physique and fencing we have. So if you get any medals in All India University level, we will convert your seat to sports quota and you will get all the benefit. Wait, don't clap, still there. So we had, I told you last time, Yenepoya University got 3 medals. We felicitated them and given cash award for the winners. And our chancellor, everybody were present for the program. These are the 3 boys who got laurels to our university. Adarsh, Nazaruddin and Ashay Krishna. 1 silver medal and 2 bronze medal we got. And these are a few of our alumni. Salah, 2010, and Akshay, Askar, Sony, all are there in the football clubs as a physiotherapist. And Shaheen Mohammed, Anandu, Subi, all this, everyone passed out. Before we used to have only physiotherapy as a sports quota. So everybody used to join in physiotherapy and they used to manage both academics and sports in a very good, manner. And they all passed out and they got a very good position in the physiotherapy, in the sports field itself. And now we started, after we started other courses like BCom, BA, now for the students' benefit, we have started giving sports quota to the BA sports studies. So they can mainly focus on the studies and not in the game, and they can manage sports. And this is the club what we have in Yenepoya. We have 3 registered club inside the university. Within the university, we have 3 registered club. One is Yenepoya Football Club, Yenepoya University Football Club. That is only a club who won 8 times in Dakshina Karnataka A Division Championship. And we have Football Club Mangalore. Football Club Mangalore plays I-League. And in Dakshina Karnataka, there is no other club is registered under All India Football Federation. Is only a club what we have in Dakshina Karnataka is FC Mangalore. And in the first year itself, we got 3-star rating in accreditation, All India Football Federation accreditation. And we played a playoff round. We qualified. We have beaten BFC, Ozone, Anantapura FC, and so and so. And we had qualified for the All India playoff round. And this is the club we have in Dakshina Karnataka. And we have a football club, FC Mangalore Academy. That is also a division club. So any footballers, if you are good in a game, you can approach me. and we have a lot of footballers come joined through sports quota. But if you give the competition to them, definitely if you play about them, I mean equal to them, then definitely we will support you. That's all about the department. If you have any queries, you can ask. And today, I know everybody, after my session, you want to go home. And one more session, oh sorry. So you have one more session. So quickly, please tell me if you have any inquiry. Any doubt? No, sir, please go. Okay, thank you. Thank you for cooperation. And the Department of Physical Education always there with you guys, because this is the one department in all the colleges you wanted. And you definitely will enjoy your graduation here, and you will have a lot of sporting activities in Yenepoya University. And I want everyone to take part in one or other event, at least in intramural competitions. So in this same opportunity, you may not get in all the colleges. Here you get intramural as well as inter-collegiate within the campus. And the students also participate in the same spirit of the sport, and the competition will be in highly competitive. And you know, most of the students are from Kerala, Karnataka and Tamil Nadu here. So this is the one place where all the good sporting activities happen. So thank you very much. Thank you.
Thank you, sir. Apart from this, for the sports, I want to tell you guys, the last year intercollegiate was equally shared. The first prize among the 10 constant colleges are there in Yenepoya University. The first prize equally shared by Yenepoya Allied Health Science and Yenepoya Physiotherapy College. So we were champions for the sports event. So I request all the students, those who are interested on the sports, please go and contact the physical education department and also the sports committee of the colleges.
Thank you, sir, for the encouraging speech. I hope now there will be a big queue in front of your department. Students have really enjoyed your session. So now I request Mr. Sharfan to just pass over the token of appreciation to Mr. Sujit. Now coming to the last session of today. Now they say charity begins at home, and here at Yenepoya University, which is our second home, we have a charity organization, Samraksha. To throw more light on this, I welcome Dr. Shama CK, the president of Samraksha, to brief the students about the vision and mission of Samraksha.
Hello everyone, my name is Shamaz. So as you all will be dealing with the patients, right? So there can't be a charity without something called a medical field. So you all are entering into a medical field. So you all will be dealing with the patients, right? So, hello. So you all will be dealing with the patients. So we have a charity called Samraksha. This is all run by the students itself of the Yenepoya. So what happens in Samraksha is, okay, fine. So under Samraksha, we have around 5 things we take care about. One is the care unit, one is the drug bank, one is the palliative care, and one is the pediatric play area we did, an orphanage and old age home visits, and clothes donation program. So what is Samraksha? So I hope everyone have done charity in their life. whoever will be sitting. So now as a student, this is your organization, not the, means it's all the organization belongs to the students of Yenepoya. So I hope everyone takes part in it. So what do we do at Samraksha? What is a care unit? So what do we do is, the patients which come to Yenepoya Medical College is basically the needy ones. I agree with you all. But there are patients who cannot even afford, you know, do you all know, anyone of you all know the price of one paracetamol? Anyone? No one? So paracetamol, I hope you all know the drug at least. What is paracetamol? Used for fever? Yes, okay. So one strip of paracetamol costs around 30 rupees. So in one strip, 15 tablet comes. And one paracetamol will cost around 2 to 3 rupees. So there are even 2 to 3 rupees, okay? So there are patients which cannot even afford that 2 to 3 rupees. So we are gonna help those patients which cannot even afford a 2 to 3 rupees tablet a day. So what do we do? How do we get the funds for the Samraksha? See, there are basically three things what we do. One is students collections, batch collections. Batch collection as in the sense, every month we'll be collecting a small amount like 10, 15, anything what you all can contribute. It's nothing like as in force as such. Anything you all can contribute to the organization, or you all have to, means if you all can, please do. In a month we'll be dividing your batches into representatives, blood bank, and one treasurer. So the treasurer's job will be, he'll be dealing with the collection of the amount from the each batches, and that amount will be going to the Samraksha account. Actually, this Samraksha charitable trust is under Yenepoya itself. So you all will be, the donation, everything will be transparent to you all. If anyone has a doubt where the money, where your money is going, or if you all have that doubt in you all can contact me and ask for the transparency of it. And next is what we do is, one more, the collections of the base collection is from, one is from the students, one is from the staff collection we do. Every year we'll do a staff collection. Staff will be giving some amount to us, to the Samraksha account. And the third thing is something called Art for Charity. That will be conducted in your college as well. Art for Charity is something, an event which will raise the fund for Samraksha. So y'all, I hope you all understood the basic of Samraksha. So Samraksha tries to help the needy people. So needy people in the sense I told you all, no, even a meal they won't be able to afford. There are some patients, I hope when we are working, in first year you all won't be able to visit the hospital and all. From second year you all will be having clinics and all. So when you all come to the clinical side, we hope we work with, you all can work in Samraksha and know how the patients are. They will be in a very pathetic situation. So we try to help those people. So what other things we do Samraksha? In Samraksha, the other things we do is palliative care. Do you all anytime heard about palliative care? Palliative care you all heard, right? It's like a treatment only. So for this palliative care is for those patients like onco 4th stage, you understood, no? CA 4th stage, cancer 4th stage, heard of it, right? So they won't have any, even radiation failed for them, even the chemotherapy has failed for them. For them we conduct a, palliative care session. And the third thing what we do is blood bank. There are many patients like the staff, the PGs or the nurse in the hospital will be telling us there is some patients, they require this blood, can you please arrange for us? So what we'll do is like, we'll have a group. Even you all will be included in that group. What we do is, we will we'll request one of you all to be the blood bank representative, and we'll ask them to note down everyone's name, blood, and and this won't be forceful. what we'll ask, request you all, if anyone is willing to donate, can donate. So I want to show you all. This is the workplace, this is our office in 7th floor in our medical college hospital. So what you all see is, this is the drug bank. What we do is, when we come to know a patient cannot afford a medicine, that we'll come to know in 3 ways. Either the staff will inform us, either the PGs or the interns. They will tell us that there are some patients which cannot afford one tablet or this tablet and that tablet. So what we'll do is, we'll take the prescription. In that prescription, we'll come to the office, we'll check in the drug bank whether that medicine is there. If the medicine is not here, we'll go to the pharmacy and we'll get it from there. Where do we get the drugs from to the drugs bank? That is the next question. The drugs, what we get from the drug bank is, have you all heard about representatives, medical reps? So those medical reps, what they will do is, they will come around our college and they will meet all the staffs and they want to promote their brand, no? So they will go to all the staffs and they will be like, sir, this is a brand and all. This is a new brand what we are introducing. They will give a paracetamol and all. They will give us samples. So what we do is, we collect all the samples. We'll collect all the samples which is going to the staffs and all, and we bring it over here. Even though we collect all the samples, there won't be enough tablet, we can't satisfy all the requirements. So what we do is, the other thing I told you, we take as much as from here, then we go to the pharmacy and credit it. And this credit money is the money which all will be contributing. I hope you all understand. So that thing you all will be contributing. So this is one thing what happens in Samraksha. And next thing is cloth program. We recently introduced this. What do we do in cloth program? See, we are privileged enough to buy a new clothes and all, right? So there are some people, some clothes which we can donate. It should not be in a very worst condition, a thing which is not required, or we feel it as used and all, we can donate it. Have you heard about laundry line? Anyone? I hope it's Yenepoya's thing only. So what we do is, see, there's an option in a laundry line to donate clothes. So you all can click on that. Click on that, and what laundry line will do is, they will wash the clothes, iron it, and give it to us. So we'll be going and collecting it. So this is the first time we did, and we got 103 sets of clothes. So 103 sets of clothes we'll distribute to the Akkas and Annas, gardeners and all over here, right? We'll be distributing to them. So this is what we did this time. They will come, they will collect it. So what are the other things? And those who will be working over here in this Samraksha and who will be taking active part, we are planned to give a certificate, which is a valid certificate. It's nothing like unvalid, and this can be used on your CVs. This will boost your CVs. I can guarantee all that because it comes under the trust and all. So if you all are planning to go outside and all, they will ask you all, what did you all do to the society? So since you all are here 3 years or 4 years and all, you all can put this as your under your CV and build up on your CVs. And this is a certificate. This was previously given to Kinan, one of the interns who had been working in Samraksha for long. So I just want to tell you all, we never know whose life you may be saving. After all, we are all here to heal, and heal we shall do. And there's a video of palliative care, what happens in palliative care. So this, So
Students, listen. The tomorrow's session for the respective departments, it will be the venue and the timing will be put up on the groups. I request all the students, please check your WhatsApp group before coming to the college. I request all the students again, please make clear before coming to the college, please make sure where is the venue and the timing. Tomorrow it's about the department thing, so I request all the students, please make sure.